I know. Good afternoon, everyone. Welcome to the Senate Finance Committee. We have several members that are across the street, including our actual chair. So I'm subbing in for her today. So we'll just go ahead and get started. Let's begin with HB 527, Delegate Charkoudian. And these are all sponsor only.
Yes.
So you can go ahead and get started.
Thank you, Madam Chair and members of the committee. For the record, Delegate Lori Charkoudian asking for a favorable report on House Bill 527. So this is related to essentially restitution, symbolic though it may be, for people who were really harmed by the debacle of Purple Line construction. So let me back up and say that I am a huge fan of the Purple Line. I think it's going to be really important and really beneficial to the communities that I represent and, in fact, to the entire region. All of the analysis suggests that it'll be a really significant economic boon to the entire region, and I am looking forward to it being operational. However, the entire region is going to benefit from it, and there's certain individuals who were harmed disproportionate to how they may benefit from it. And I say that because it was very poorly managed over the last 8 years. It has gotten better over the last 2 years, but the debacle of how badly it was managed over the last 2 years means that there are communities all along the Purple Line who have had their roads torn up, have had I'm just going to give a couple of examples because I think it's unimaginable unless you actually spend time there. So there's parts of areas with small businesses, primarily immigrant-owned small businesses that are sort of hanging on by a thread, and they have had their road closed for going on 3-4 years. You literally have to climb over Jersey barriers. One of our witnesses in the House was from Kefa Cafe. She and her sister walked across large swaths of Ethiopia and Eritrea to flee a war, to come to this country, start a small business with all of the savings they have. And they were doing relatively well, but struggling as a small business. And now, in order to get to their small Ethiopian coffee shop, you have to climb over Jersey barriers. And it has been that way for years. It's been described as a war zone in downtown Silver Spring. There's been places where there are, in areas where people are trans-independent, where 2 sidewalks are both closed at the same time, where buses and bus stations are inaccessible. And it has been because the contractors and subcontractors have not cared about pedestrians in the community, or frankly, anyone in the community. Now, I've been advocating on this for a very long time. In fact, I have redesigned my running routes so that every morning when I'm in Tacoma Park and not here, I actually run sections of the construction zone, and I stop on a regular basis to take photos of places where people would be on the sidewalk and suddenly in a construction zone, where 2 sidewalks are both closed, where there's massive dangerous situations for children who are walking to school. And this is a real problem because it's affect my PRs because I have to keep stopping and taking photos. That was a joke. But I do have to keep stopping and taking photos. I get home from my run, I upload my photos to the Department of Transportation. I do want to say that it has gotten better under the current administration. I've worked very closely with MTA Administrator Arnold and her team. But what this bill does is it acknowledges to the residents and to the businesses that the sacrifices they've made go above and beyond what we would expect for people making it through construction of anything, highways, transit, whatever it might be. And so in a symbolic way, we give some restitution. Every resident who lives within a quarter mile of the Purple Line construction would receive 1 month of free ridership. That both is a token of what they've suffered. It's also will promote and hopefully support them actually being paid riders after the month is over. And businesses along the line will receive business promotion, whether that would be, when I started the bill originally, specifically said ads on the Purple Line. We made it more general because it'll allow MDOT to find other ways to do promotions of the businesses along the purple line. And the hope is that those who have managed to stay in and survive will ultimately be able to benefit from the purple line. So that's the bill. I'm sorry that Senator Alonzo Washington is not here. Augustine also is on the purple line. But if you talk to any members of the Senate who have communities along the purple line, they will tell you similar stories. And I did get a chance to speak to Senator Washington in advance of this hearing, and I'm sure when you get to voting, he'll share his own sets of stories. Happy to take any questions if you have them.
Thank you very much, Delegate. Any questions? I don't see any questions from the committee, so.
Thank you so much.
Thank you very much. All right, we'll move on to HB 861 and see Delegate Von Stewart here. This is also just sponsor only.
Thank you, Madam Chair, members of the committee. For the record, I'm Delegate Von Stewart. This is House Bill 861. This bill is about transportation network companies like Uber and Lyft. When the bill came in on the House side, it was fairly ambitious, but we worked with the folks from Uber on the set of amendments that are before you today. The amended version of the bill requires transportation network companies to provide their drivers, their operators, with weekly reports about their wages, namely the percentage of the fare that the passenger paid that they're getting as a wage. So they have an opportunity to know what their sort of percentage, what their take home is, so they can make decisions about which companies they want to work for based on the percentage that they're getting paid. The bill also requires these companies to report to the Public Service Commission, which regulates cabs, with certain information about the number of rides taken and the wages they pay. And as amended, there's no opposition, and I urge a favorable report.
Thank you very much, Delegate. I don't see any questions from the committee, so thank you very much.
Appreciate y'all.
All right, next up we have HB 1142 and my delegate, Delegate Heather Bagnall.
Thank you, Madam Chair. Madam Vice Chair and members of the Finance Committee, I'm not sure who everyone is the role today. For the record, I'm Delegate Heather Bagnall, here from District 33C in Anne Arundel County, here in strong support of House Bill 1142, the cross-file of Senate Bill 920. Maryland Interested Parties Advisory Group established. You have my written testimony, so I will summarize. Direct care workers are a pillar of Maryland's health system. These are the workers who provide home care and community health services for our state's residents with disabilities and our aging populations. Despite being an essential part of our workforce, our direct care workforce is struggling to meet our state's needs and are often the last ones at the table to receive assistance and recognition for their work. Now, the federal government recognizes this. The Centers for Medicaid and Medicare Services recently released the Ensuring Access to Medicaid Services Final Rule, also known as the Access Rule. Among the provisions of this rule, states are required to establish an interested parties advisory group of direct care workers and other interested parties in home and community-based services. Through this advisory group, direct care workers will provide much-needed advice on reimbursement rates and other CMS policy affecting their workforce. Now, the goal of this advisory group is very much in line with work that this committee has accomplished to uplift our home care and community health workers. Under the Access Rule, each state must convene an interested parties advisory group by 2027. It will take time for recommendations to equate to real action, so House Bill 1142 allows Maryland to begin work on implementing this advisory group now so we can see real change for our direct care workers as soon as possible. With this bill, we have an opportunity to continue our work to stabilize the direct care workforce, improve pay transparency to direct care workers, and increase choice for Marylanders who rely on direct care workers. We collaborated with the department on the language to ensure that it aligned with the federal guidance, and at the request of the subcommittee in the House, added an additional member from a residential service agency, which we believe strikes the right balance between ensuring we are centering the voices of workers, but also addressing the complexities experienced by providers navigating the Medicaid system. And as amended in the House, there is no longer a fiscal note. House Bill 1142 ensures everyone has a seat at the table, and Maryland continues to lead the way. And for all these reasons, I respectfully request a favorable report on House Bill 1142.
Thank you very much, Delegate. I don't see any questions, so thank you very much. All right, next up we have HB 1246, Health Benefits Plan, Delegate Steve Johnson. Delegate.
Thank you, Madam Chair and committee members. For the record, my name is Delegate Steve Johnson, here to present House Bill 1246, Health Insurance Coverage for Specialty Drugs. This is basically a bill that is crossed with Senate Bill 773, although not in the exact same posture. This bill would apply discounts and coupons towards your deductible for, your deductible for prescription drugs. I want to thank Senator Hershey because he's worked with us a lot on this bill to work out the things that were different in the bills. And we think we have the last issue worked out that will make these bills in the same posture. And with that, I would ask for a favorable report on House Bill 1246.
Thank you very much, Delegate. I don't see any questions, so thank you.
Thank you.
All right, next we have HB 1503, Secretary Grady. We also have Neil Desai and Danielle Miller from the Attorney General's office.
Thank you. Good afternoon, Madam Chair, members of the committee. Thank you for inviting us to present testimony in support of our departmental bill, HB 1503. My name is Helene Grady. I serve as Secretary of Budget and Management. I have two colleagues with me today in case of questions. Neil Desai is our recently appointed Chief HR Officer with oversight responsibility for the SPMS, and Danielle Miller is an Assistant Attorney General assigned to DBM, who has been our lead working on this legislation. You have my written testimony from the House hearing, so I won't read that here. Just to summarize, we are excited to move ahead with launching the new family leave program for state executive branch employees effective July 1st, 2026, per the details in the proposed legislation. Under this program, state employees will be able to take leave for reasons such as welcoming a new child, caring for their own or a family member's serious health condition, or making arrangements for a family member's military deployment. DBM began preparing for the implementation of the new family leave program for state employees last fall when we engaged in bargaining with each of the labor unions to reach an agreement on the structure of the leave program. HB 1503 is the outcome of our negotiations. The program design not only complies with, but exceeds the requirements of Maryland's Department of Labor's new family and medical insurance program. And our intent is to roll it out ahead of the new proposed schedule for the Department of Labor's program. Per the bill, state employees will be eligible for the new leave as of July 1st, 2026 at the employee's regular rate of pay, and state employees will not make contributions from their pay. Very importantly, this bill repeals the state personnel and pensions provisions related to the current parental leave program for the simple reason that the proposed family leave program will allow employees to receive the same amount of paid leave without having to exhaust all of their accumulated personal and annual leave first. We're very excited at the prospect of how this new benefit will advance the administration's goals for improved recruitment and retention of state employees and enhanced employee well-being, and ultimately engagement in their work. Last, I want to mention that we understand that the University System of Maryland has submitted some proposed amendments to the bill, which was done in coordination with DBM. We request the committee's favorable support of HB 1503 and are happy to answer any questions.
Thank you very much, Madam Secretary. And the other two, you're both here for just questions only, is that right? Okay, great, thank you. Secretary, or Senator Reedy.
Thank you so much. Thank you, Secretary Grady. Good to see you.
Good to see you too.
This bill is, does this bill have the effect, this doesn't have anything to do with delaying implementation for everybody else in the state. Does this bill only speak to state personnel?
Only state personnel.
Okay,
That's correct.
And so we would have had to have this take effect in July of this year, right?
Originally?
Originally.
I believe that's correct. Is that right, Danielle? July of 2025 is the original date?
And now we're moving it.
Well, yeah, there's...
But this was post that initial postponement, because we only bargained this with the unions as of this past fall, and that's when we developed this legislation before us.
Okay, so I'm looking at the fiscal note, and I'm just trying to understand how this all works. Because we actually had some questions when we were discussing the overall paid leave program earlier this session with the Labor Secretary. Yep. So the state, because the state, you don't have to require employees to put in money from their paycheck for this, correct?
Our plan design that's in the legislation before you does not require employee contributions from their pay, and that's what we negotiated with our unions. So the state of Maryland is choosing to deliver the benefit through a self-insured plan rather than falling under the criteria of Department of Labor's plan, and that's one of the key differences.
Okay, and anybody can, any group, any county government, any other government entity, any self-insured entity can do this, right? Under the paid leave law?
That's my understanding. I think that's
That's
Danielle's
correct, yes.
understanding,
I'm just
but
checking. I'm just trying to
certainly
understand the-
Department of Labor has purview over the broader
Okay.
program.
Because the state is not having to pay a wage, well, you're paying them a wage to take their time when they take their time, but
Yes.
it's same as how you pay annual leave.
Annual
or-
leave.
Okay.
And today, parental leave. So we are replacing, we're
You're
proposing to
swapping.
replace the current parental leave program with this new family program.
And what is the parental leave time right now?
It's 12 weeks as well.
12 weeks as well. So it's just a one-for-one change.
Yeah, one of the major drawbacks of the current program is that employees have to exhaust their current accumulated leave before they can benefit from parental leave. It becomes a real disincentive across the workforce.
So this is letting them not do that.
Exactly. That's a major enhancement from our point of view.
It is, but you also get but also, and I mean this from a good sense fiscally, you also get the benefit of you're not stacking it on top of the parental.
Exactly.
They
That
get the
was
one.
our other priority in our negotiations, which, focused around the replacement of the current parental leave program, not adding to.
It does say, so the fiscal note does say, so it talks about what you just said, and it says that your state expenditures decrease by not having to do the
Contribution to the
contribution.
trust.
It does start talking later in FY '27 that they begin to, the expenditures begin to increase to provide and administer paid family leave. So I guess it's a little ambiguous. How do you guys plan or manage to balance the additional expenditures? Because obviously the plan with the Labor Department is going to require a lot of potentially employees and a lot of.
State contribution
Yes, yeah.
to the
so,
trust. Yeah.
Okay, so how do you guys manage that?
I think the fiscal impact of what we're proposing, which is really just around the administration of the leave benefit, the reporting with Department of Labor, et cetera, is pretty immaterial compared to what the cost would be if we were participating in DOL's program and contributing to the trust.
Because all you have to do then is just tell the Labor Department, here's what we're doing, right?
Yes,
okay.
exactly.
All right, thank you very much.
Thank you, Senator. Senator Mounts.
Thank you, Madam Chair. So the bill, I was reading the fiscal report, I'm trying to verify, when does the bill take effect? July 1st, 2026? It does.
Yes, that's correct. We amended it to push it forward to
To conform
2026.
with the changes of the delay of the implementation of the family
No.
medical leave, or?
No, it was so to ensure continuity with the parental leave, because the legislation was initially drafted that parental leave would have been repealed as of October 2025, and we did not want to leave a gap in coverage.
Okay. And then I guess, so this would sort of expand parental leave or change parental leave. I was looking for a cost in the fiscal note, and I couldn't find it. It's probably there, but.
So the proposal is actually replacing the current parental leave. Just to clarify, it's not expanding or coming on top of, it's replacing. So
Okay.
the fiscal impact of the leave design itself is indeterminable, but not material in our point of view, because currently employees can access 12 weeks of leave under the parental leave program. They can also access under FMLA. But this is a enhanced benefit design in that they don't have to exhaust existing leave prior in order to access the new family leave.
Yeah, but so in
That's the
essence,
primary difference.
there is not really a cost with this.
There'll be some cost for administering. I think it was not quantified in the fiscal.
And then this is a bit of a trivia question, but how many employees would be covered?
Oh, that's a great question. So under SPMS and MDOT, which are the two main personnel systems for which we negotiated this change, you're looking at approximately 50,000 full-time workforce. As we mentioned, USM, I think, has submitted some amendments, and so those numbers are not including USM. I'm not exactly sure myself how they plan to administer or the differeres with what we're doing for
Okay.
exec
And-
branch.
Yeah, and in ballpark figures, I was just wanting to get a good understanding of what we were referring to. So,
Okay.
thank you.
Sure.
Thank you, Senator. I don't see any other questions. Thank you very much, Madam Secretary.
Thank you.
All right, next we have House Bill 1082, Health Insurance Individual Market Stabilization. I know there's somebody here from, no, I'm sorry, Marie Grant. I believe Commissioner Grant was going to be doing this one for Delegate Penny Melnick, Madam Chair Penny Melnick.
Thank you so much, Senator Guile. Committee members, Marie Grant, on behalf of the Maryland Insurance Administration, and I guess today on behalf of Chair Penny Melnick, here in support of House Bill 1082. I want to explain a little bit of the backdrop of the need for this bill. In 2021, our federal Congress passed enhanced subsidies that folks on the individual market are accessing that have greatly increased the affordability of individual market coverage and led to historic gains in individual market coverage in Maryland as well as nationwide. Those subsidies, without any further action by Congress, are scheduled to go away after this year. So in my role, I am a member of the National Association of Insurance Commissioners. There's bipartisan support among insurance commissioners to have the federal government replace these subsidies. But given everything that's going on the federal level and the uncertainty, what this bill does is allow the exchange to use for calendar years 2026 and 2027 part of the surplus related to in the reinsurance fund that comes from an annual assessment to design a Maryland subsidy that would mitigate the impact of the loss of those federal subsidies should they go away. Now, the way the subsidies are designed is complex. So I can't give you an exact dollar impact. It really depends on your income as well as your age. But we estimate that up to 80,000 people could leave our exchange, and then the impact of that amount of folks leaving the exchange, because we think it will probably be the healthier folks, will lead likely to an increase in rates in the individual market for everyone, regardless if you're receiving a subsidy or not. So it hits twice. The impact of losing these subsidies without doing something hits twice. I think at the Insurance Administration, our actuarial team is obviously wanting to make sure that we still have funds for reinsurance, because that is an incredibly important program for affordability. And so there is some language in this bill that the design of the subsidy that the exchange undertakes in consultation with our team will need to take into consideration state funds needed to ensure the viability of that reinsurance program, as well as take into consideration uncertainties in enrollment in Medicaid, the individual market, and the small group market. This is a program that would be, again, only in effect for 2 years. There's a sunset on the bill, and the hope is that this creates a bridge to our next discussion of what our future waiver with the federal government for our individual market looks like in terms of reinsurance subsidies and other things we might want to do. So with that, happy to answer any questions you may have.
I don't see any questions. Thank you very much, Commissioner Grant. And you can actually stay up here because I think you have the next, you're also on the panel for the next several. So we'll move on to a House Bill 718, Maryland Health Insurance Coverage Protection Commission established, and Delegate Rosenberg. Also, I think I may bring up Stephanie Clapper as well.
Madam Chair and members of the Finance Committee, Delegate Sandy Rosenberg with my distinguished team here on behalf of House Bill 718. This bill could be called the deja vu all over again bill, because 7 years ago, using basically this language, we passed a bill so that we could be in a position to study, analyze the changes in federal law that were anticipated with the first Trump administration, the very possible likelihood, if it weren't for John McCain, of the repeal of the Affordable Care Act, and what should we be doing to preserve the many reforms that we had enacted to extend health insurance coverage to those who could not afford coverage prior to the Affordable Care Act. We face the same problem now, specifically with Medicaid coverage, because the bill adopted by the Congress mandates $800 million in cuts plus from a certain committee in the Congress whose jurisdiction is principally Medicaid. So this is going to happen, and we would be prepared for it if we feel in the House, if you were to move forward with this legislation. So that is what the bill does. It's drafted from the bill of 7 years ago, literally. So urge a favorable report, and thank you.
Thank you very much, Delegate. Who wants to go next? Commissioner Grant?
Sure. Thank you very much, Senator. Marie Grant on behalf of the Maryland Insurance Administration, just here in support of the bill. We think it's important to convene executive branch, legislative stakeholder body to continue to take a look at these issues given federal uncertainty. We're also happy to support the work of that commission through staff support. So urge a favorable report. Thank you.
Thank you very much. Stephanie?
Thank you very much. Stephanie Clapper, Deputy Director with the Maryland Healthcare for All Coalition. And I want to especially thank Delegate Rosenberg and Chair Pena-Melnick for sponsoring this legislation. We represent hundreds of faith, business, labor, community, and healthcare organizations across the state working toward quality, affordable healthcare for all Marylanders. And in 2017, under your committee's leadership, Maryland created a Health Insurance Coverage Protection Commission back then. Out of that commission came recommendations like codifying ACA protections into state law, the reinsurance program, young adult health insurance subsidies, and also the easy enrollment program. And those have been great successes here in Maryland. Now we are once again under threat, and we strongly urge you to give a favorable report to create a commission once again. And we also would support a MAKO amendment for them to get a seat at the table. So thank you for your leadership, and we urge a favorable report.
Thank you very much, Stephanie. I don't see any questions, so thank you very much, Delegate. We also have 2 favorable with amendments.
Thank you.
Thank you. The 2 favorable with amendments, Brett Leininger and Carrington Anderson.
Thank you, Madam Chair, members of the committee. My name is Carrington Anderson with the Maryland Association of Counties, supportive with amendment on House Bill 718. This bill establishes a commission to monitor and assess the effects of potential and actual federal changes to healthcare programs. The commission is set to provide recommendations for state and local actions to protect residents' access to the affordable health coverage. Counties are just requesting that if the commission is tasked with also providing local recommendations, then we would request to have a seat on that commission, since it would also be recommending local recommendations. So for those reasons that we would respectfully request favorable with amendments. Thank you.
Thank you, Carrington. Brett?
Thank you, Madam Chair, members of the committee. Brett Leininger on behalf of NAFA Maryland, National Association of Insurance and Financial Advisors. Many of our members are health insurance producers who are the boots on the ground in helping people get access to coverage. I think we'd be a very vital voice in the commission and would love the opportunity to have a seat at the table.
Okay. I do not see any questions. Thank you very much for your testimony. All right, next we have House Bill 820, Health Insurance Utilization Review Use of Artificial Intelligence. Somebody from Delegate Terry Hill's office. We'll also bring up Dana Kaufman and back up Commissioner Grant.
Madam Chair and members of the Finance Committee, good afternoon. My name is Alicia Pan, and I am a master's student at the Johns Hopkins Bloomberg School of Public Health and a fellow in Delegate Hill's office. I'm here to present HB 820, a bill to ensure that automated machine learning systems used in healthcare utilization review decisions are applied responsibly. This bill emphasizes that healthcare decisions should be individualized, grounded in clinical need, and based on provider documentation. It holds carriers accountable for these tools and responsibly in using these tools responsibly and centers on improved patient outcomes. Also, this bill helps us assess whether current safeguards are sufficient or if additional protections are needed for the ongoing use of these technologies with minimal negative impact. Artificial intelligence is no longer a future concept. It is being utilized everywhere. One particular area of concern is AI utilization in medicine, which is already shaping our healthcare systems, how we process claims, decide on coverage, and determine what care people can and cannot receive. While AI holds incredible promise, especially in reducing administrative burdens, left unchecked, this tool can be extremely dangerous when not focused on individuals' clinical needs, but on broad population data that doesn't reflect a patient's health circumstance. At its worst, the utilization of AI for these decisions can deny care, worsen health outcomes, and deepen disparities. For example, a February 2025 study found that AI-generated hallucinations, defined as instances where the model produces incorrect, misleading, or nonsensical information, were presented as medical facts up to 24.6% of the time. Relying on the unchecked and unsupervised use of automated machine learning systems to determine health utilization decisions is dangerous for patients. Medical errors are too critical to be based on imaginary facts. I urge you to give HB 820 a favorable report. Thank you.
Thank you very much. Commissioner Grant?
Thank you, Senator. Committee members, here in support of House Bill 820. This bill, in our eyes, does two very important things. First of all, it does require, with adverse decisions and reporting, we've talked a lot about adverse decisions this session. It would require our health insurers to report to us whether an AI algorithm or other software tool was used in making the adverse decision. I think giving us better insight into what is happening in the market with this work. And then secondly, as was already very eloquently noted, the bill places a lot of requirements about what our PRAs, PBMs, or carriers need to do if they are using this type of software. I think we view this as a really important first step. We are working with that National Association of Insurance Commissioners on broader reporting, and we should be in the next several months getting better insight into what's happening in the health insurance market writ large with regards to AI, but again, this is a good first step, and so we're in support of the bill. Thank you.
Thank you very much. Dana?
Thank you very much. For the record, Dana Kaufman with MedChi. We are also in support of the bill. We think one of the most important provisions is making sure that any final adverse decision is tied back to our current language that requires a physician in the same specialty make that final decision. So while we understand the use of AI, we do think that that is a critical component. And with that, we urge a favorable vote. Thank you.
Thank you very much. I don't see any questions from the committee, so thank you very much for your time and testimony. We have one favorable with amendment. Ernice Williams, if you could just come up. Thank you.
Good afternoon. Ernice Williams, Deputy Director of the Health Education and Advocacy Unit of the Office of the Attorney General. We did submit testimony that reflects the complexity and impact of AI in the utilization review process, and we strongly support this bill and all the work that Delegate Hill has done to protect consumers and bring solutions to this critical issue. We just want to draw attention to two amendments that we submitted. One that would just include language that shows that the enrollee and not just the provider submits claims on the grievance process, and the other amendment that would require a disclosure if AI is used while making decisions that have an impact on healthcare services or coverage. So we did submit those amendments in the House, and we're submitting them again here for your consideration.
All right, thank you very much for your testimony. Appreciate it. Okay, and that ends the bill hearing on House Bill 820. We'll move on to House Bill 974, Health Insurance Preventative Services, Delegate Shetty. And we also have Commissioner Grant on this one as well.
Great. Hi, good afternoon, committee, Madam Chair. For the record, my name is Emily Shetty, delegate from District 18, Montgomery County. Thank you for the opportunity to testify in support of House Bill 974. Very simply put, this bill would codify in state law the existing Affordable Care Act protections we have for $0 copay coverage of preventive services. So in the 10 years since the ACA was implemented, over 1.5 million Marylanders have been able to access coverage for at least one free preventive health care service like immunizations, wellness checks, cancer screenings, birth control. More than just having access, they've come to rely on these free life-saving health services. We all know the value of early detection and prevention, so I won't go over that too much today. But should federal action threaten these existing protections that Marylanders enjoy, then just like we did in 2020, by codifying the ACA provisions on essential health benefits, we must now protect free preventive care in our state code. So this bill passed with overwhelming support and with no industry opposition. It represents Maryland's commitment to continue to make evidence-based healthcare decisions and protect preventive services that save lives. We did hear from Care First, and I want to thank them. They caught a minor thing that we missed in the language that passed out of the House. We worked with Ms. Grant, Commissioner Grant, and her team, as well as Care First, and all of the stakeholders to adopt an amendment or to propose an amendment that the committee should have on file. My staff sent it a few hours ago. And that would just make sure that we're protecting high deductible health plans that have health savings accounts if there's a change in federal law around preventive services coverage. So everyone is still in agreement on the bill and the amendment, and I respectfully request the committee's favorable consideration of HB 974. Thank you.
Thank you very much, Delegate. Commissioner Grant?
Thank you, Senator. Marie Grant on behalf of the Maryland Insurance Administration. Just here to say me too. I do want to flag perhaps that this bill is really important to ensure coverage as a result of uncertainty on the federal level, but there's actually some litigation out there too that this bill helps protect us against. There's a case that's going to be heard by the Supreme Court this spring about sort of delegation, and so this helps ensure that this benefit stays on in Maryland regardless of what might happen with that litigation as well.
Great, thank you. Senator Mounts.
Thank you, Madam Chair. Just to help me understand the bill, so this is just for contraception, or is it?
No, for all preventive services.
All preventive
Yeah.
services?
So
And then in the code, so that right now it's required, it's already required by law.
by federal law.
By federal law?
Yes.
And so what's happening right now is that the cost sharing, this cost sharing is not, that federal law is not being somehow enforced in Maryland?
No, forgive me, Senator. Thank you for the question and the opportunity to clarify. So the federal law is the Affordable Care Act that codifies this guarantee, and it ties it to specific services that are identified by the U.S. Preventative Services Task Force as being deemed like eligible for this coverage. So this includes immunizations. It includes screenings like mammograms, colonoscopies, right? Like things that are evidence-based that show that if you catch something early, right? We want to incentivize this by having patients have $0 copay coverage, right? If you catch something early, it's easier to treat, it saves money, it helps patients, it's generally a good thing. What is happening is at the federal level, the ACA is under attack by potential changes by Congress. But separately, as Commissioner Grant noted, there is Supreme Court litigation happening right now challenging the USPSTF's authority. And so what this bill would do is it would it would sort of freeze in time and codify the existing protections that the federal law are guaranteeing Marylanders should anything change based on the litigation or acts of Congress.
Okay, thank you.
Yes, sir. Thank you for the question.
Thank you very much. I don't see any other questions, so thank you for your testimony. Thank you for this bill, Delegate.
Thank you.
We have one favorable with amendment. I don't see Kimberly here with us.
Can I just note, Kimberly is with Care First, and Care First is the one that had the amendment that we worked on that the committee now has.
I see.
Yes.
Okay,
Thank
great.
you.
Thank you for that clarification, Delegate. Appreciate it. Okay, well, we will move on then to House Bill 1098, Insurance, Automobile Insurance, Maryland Automobile Insurance Fund and Affordability Study. Delegate David Fraser Hidalgo has been waiting very patiently, and also Commissioner Grant back up.
Thank you, Madam Chair. Members of the committee, for the record, Maryland State Delegate David Fraser Hidalgo, here presenting House Bill 1098. This is an insurance bill, and as all of you know, I'm sure you've received not only your own bills, your car insurance bills lately, but you've probably been notified by some of your constituents just the increased cost of auto insurance. So what does this bill do? This bill does a couple of different things. One of the things that this bill does is creates a study to help try and advise us and advise the industry as to why all the different inputs as to why automobile insurance has risen as much as it has. And it also addresses some issues with MAIF coming coming on a more regular basis lately and asking for an assessment because, as I said, as many of you know, insurance has really been skyrocketing lately. So the bill provides for a study, and it also provides for some guidelines for MAIF to help to put MAIF in a position where they come back less often looking for an assessment. And we've communicated both with MAIF, with MIA, the commissioner's here to speak as well, and with Chair Beidel is very aware of the bill, and we've been trying to work in cross purposes to try and get something across the finish line. So there is no cross file. I know the chair has a bill that's similar. I think was kind of a bit of a placeholder depending on how things worked out. But with that, I would be happy to turn it to Commissioner Grant to follow up on some more particulars and then answer any questions if that's the will of the committee.
Great. Thank you very much, Delegate. Commissioner Grant.
Thank you, Senator. Committee members, Marie Grant on behalf of the Maryland Insurance Administration. So yes, I know I've been in here with you all talking about Maryland Auto. This is a bill that I think really, as Delegate David Fraser Hidalgo talks about, addresses a couple of things. It addresses sort of the solvency of Maryland Auto for future years, and then also has a study of affordability in the private passenger auto market writ large, including a look at the affordability index. So HB 1098, as it passed the House, requires Maryland Auto, starting December 31, 2026, to maintain a certain level of risk-based capital or surplus to help protect itself against uncertain situations, market fluctuations, the need for future assessments. It also gives the Maryland Insurance Administration prior approval authority for the remainder of 2025, and then anytime. I do want to add there was one other amendment that actually Maryland Auto and MIA did agree on. The Economics Matters Committee took a yeah. Would you like to?
Yeah,
address
I'm happy
that
to. So there was an amendment to the bill that provided a bit of a buffer for MAIF that we all agreed was a really great idea, and that's an additional $20 million, which would basically give us a little bit and give MAIF a little bit of time before they came back to look at an assessment in the future. They didn't usually have a buffer that large, and we all thought it was a great idea. And as we proceeded, we started looking at everything else that's going on in the world with rates, and we started looking at our own budgets, and we started looking at what we're asking people to pay. And then we, at the kind of last minute, we created a floor amendment to pull that piece out, just because we thought with tax increases and everything that's going on in the state of Maryland and around the world, around the country, that piling a little bit more on, while it wasn't going to be a lot to the average policy, we just thought this was not the time to pile on. While we thought it was a really great amendment and we really liked it, I'm sure everybody here understands exactly why we pulled it off, which came recommended by a member of the subcommittee, which I thought was a great idea, which is why you see it was actually amended on the House floor.
Senator Guile, just one other point really quickly for clarification. We are in the process of working with Maryland Auto on the calculation for an assessment for calendar year 25. The total amount of that is $19.4 million. It'll be spread out across private passenger auto companies who then have a choice whether to pay that assessment or to pass it on to their consumers. That is currently happening right now. And under the current financial situation, we do anticipate that Maryland Auto will need to come back for another assessment in calendar year 26. The amendment to Delegate David Hidalgo's point allowed Maryland Auto to assess more, up to a cap of 20 million, just to put them in a better financial footing going forward. And I think the trade-off that you all will have to consider, that the Economic Matters Committee considered, is the balance of whether you want that larger assessment in calendar year 26 or potentially multiple assessments in future years, or higher rates for already high rates with Maryland Auto. So,
All at once or split it up?
Yeah.
Either way, it's kind of coming.
All right, thank you very much. Senator Mounts.
Thank you, Madam Chair. I was going to go into the whole affordability. We had a big discussion about this.
That's a big piece of the bill,
private market, affordability, MAIF, and all that works. And I was going to ask you about the study, but I've gone through, had a chance to read the bill. And the question I was going to ask you, I see is in the bill, the points, but so is there going to be a report? How is all this going to be combined, and what will be the deliverable from what? Would that be a communication between MIA and MAIF, or is there a report for the General Assembly, committee members? How does all that transpire?
The report will be presented to the General Assembly, and I think it's before next session, right?
it's January 1, 2026.
January 1, 2026.
And when would the assessment, where are we, the assessment you said spread over?
So the current assessment process that is undergoing, we're in the process of certifying calculations. Maryland Auto's board has signed off on it, I believe. And Executive Director Redmer will keep me honest here, but the exact calculations will be transmitted to the companies in the spring, and then over the course of the remainder of 25, companies will need to make a decision on whether or how to assess their policyholders or not.
Right.
Yeah.
Right. So that happens.
That's the first year, and that's happening right now, no matter what you do.
Right. Right. Okay.
And part of this bill and part of the affordability study is designed to try and create a situation where we don't have as many, or a little bit more solvent going forward for MAIF, if that's helpful.
Yep. Thank you.
Thank you.
Thank you, Senator. I don't see any further questions. So that ends the bill hearing on House Bill 1098. And I think Commissioner Grant, you're dismissed.
Thanks. It's always great to be here.
You don't want her to just camp out?
Unless she wants to.
Always a pleasure to be here.
Yeah, thank you.
Thank you. Thank you.
Thank you, Delegate. Next, we have House Bill 996, Public Health. I know I'm probably going to mispronounce this. Phenibut? No, Phenibut, whatever. Consumer Protection. Thank you, though. Consumer Protection Act, Delegate Harry Bhandari.
Madam Chair, for the record, Delegate Harry Bhandari. Thank you for the opportunity to testify House Bill, Public Health Phenibut Consumer Protection Act, JT-LV Phenibut Consumer Protection Act. This bill passed unanimously from the committee in the House. This is a substance, very unregulated and increasingly accessible substance with dangerous potential, one that too many Marylanders are unknowingly putting into their bodies. Marketed as a harmless supplement for anxiety and sleep. This Phenibut has been linked to dependence, withdrawal, and even overdose. Unlike substances that undergo rigorous FDA oversight, this substance is often sold with misleading claims, inconsistent labeling, and unknown risks. This bill takes critical steps to protect public health and consumer safety. This bill ensures truthful labeling. Manufacturers must disclose the scientific basis for any claims made about phenibut effectiveness, and consumers have a right to know what they are taking and whether those claims are backed by evidence. And protection against adulteration as well in this bill prohibits the sale of contaminated and mislabeled phenibut products. Without regulation, consumer may unknowingly ingest unsafe or toxic substances. In age restriction, minors are particularly vulnerable to the harmful effects of phenibut. By restricting sales to individuals 20 and older, we can limit youth access to these potentially addictive substances, and responsible advertising as well, and health. We took this amendment. The risks are real. The consequences of inactions are dire, and Maryland should not be unknowingly exposed to harmful substances due to this deceptive marketing and lack of oversight. This bill is named after J.T. Elby, who lost his life, and I got this bill from their parents. So I strongly urge this committee to issue the favorable report on this bill.
Thank you very much. Senator Jackson.
Thank you, Madam Chair. Delegate, what is phenibut? What is that?
Yeah, this is a unregulated substances that has emerged on the market with a little bit oversight, and it's basically synthetic derivative of GABA. Is often marketed as a supplement that you can buy in a convenience store. And
So you say like GABA?
Yeah, the derivative of GABA. That's their scientific name. And people believe that it improves sleep, reduce anxiety, and enhance cognitive performances.
So is it a supplement? Or?
Yes, a supplement.
Oh, a supplement.
Yep.
Okay.
Yep.
Okay. Thank you.
Thank you, Senator. Senator Reedy.
Never mind, I'm good. Thank you.
Okay, it's good. I don't see any other questions. Thank you very much, Delegate. You may as well just stay up here because you have next House Bill 1555, Funeral Establishments, Crematories, and Reduction Facilities Oversight. And bringing up Deputy Secretary Dr. Kalyan Raman, somebody else from his office.
Hey.
You can go ahead and get started, Delegate.
Yeah, thank you. Again, Madam Chair, she just arrived, Vice Chair and member of this wonderful committee. Thank you for the opportunity to present House Bill 1555, the Ensuring Dignity and Accountability in Crematory and Funeral Home Operation Act. This bill is deeply personal for so many, critically urgent and essential for the people of our state. When families lose someone they love, they turn to funeral homes and crematories in their most vulnerable moments. They expect dignity, respect, and care for their loved ones. But recently, that trust has been shattered. Investigation in our state reveal horrifying truth. Bodies left to decompose, remain mishandled, and grieving families left to wonder whether the remains they were given were truly those of their loved ones. This is not just negligence, and it is a betrayal. On February 14th, during our committee, Health and Government Operations Committee briefing, we heard these heartbreaking stories. The silence in that room was so profound, not because people had nothing to say, but because the weight of grief was too heavy for words. I looked at the audience and saw stillness, pain, and quiet demand for justice. The silence has a power, and this bill was born out of that silence. I've served on the committee for 7 years, and we work together. We have seen families come to our committee broken, seeking answers. And we have built something important in that space: trust, transparency, and hope. That's why I started drafting this bill mid-hearing. I could not sleep that night, though the filing deadline had passed. We moved this bill through the Rules Committee. We would have to suspend the rules as well, because that families cannot wait. The bill was passed from House unanimously as an emergency bill. And with this, with the amendment, we took a heavy amendment. As amended, this bill now requires the Office of Crematory Oversight, OCO, and the State Board of Mortician and Funeral Directors to conduct at least 2 announced inspections annually of certain facilities. And we found that there are some funeral homes not inspected since COVID. That is not accepted. And it established and maintain a public online database with certain information. And if OCO or the board finds that a person has violated this requirement with gross negligence, improperly handled human remains, or repeatedly violated specified this requirement, the person is subject to civil penalty up to $25,000. The original bill had $50,000, so we compromised to $25,000, permanent revocation of licensure, and refer for criminal persecution. There are amendments. We accepted that it strikes the requirement to adopt regulation on refrigerations, holding facilities, requires twice yearly unannounced inspections by staff only of certain facilities, and it strikes requirement for inspection within 30 days after sanitation violation, strikes language regarding inspection and staffing, and alter the information to be published on the database. If they found only violation, those data will be published. Let me clear, this is not about punishing the industry. Ethical funeral homes that treat families with respect have nothing to fear. This bill is about stopping those who exploit grief and violate sacred trust. And some may say this is too harsh. I ask, is it too harsh to demand dignity for the deceased? Too harsh to give families certainty instead of doubt? I don't believe so. And our state constituents, they deserve better. We have worked with industry leaders, Maryland Department of Health, and voices from the community to ensure that legislation is both practical and fair. And as I mentioned, we have taken as many amendments as we could in the House, all while making sure the intent of the bill remains intact. Again, to protect families, ensure accountability, and restore trust. And I would like to express our wonderful chair, Penia Melnick, for her leadership, bringing us together. And at Governor Westmore's request, Charles Siller conducted an in-depth review of the Board of Mortician and Funeral Director, resulting in 18 recommendations, including 4 urgent reforms. And his expertise has been instrumental, and we're grateful for his collaboration as well. And this bill includes those amendments. And again, this bill is about more than regulation. It is about justice for those who suffer. It is about accountability for those we entrust with our loved ones. And it is about hope that families bring to this legislation. At the end, let me also say this clearly. If there are more things to fix, we can return and do that next session. But right now, we cannot let the perfect become the enemy of the good. Due to the time crunch, we must not delay the progress of this bill. We have spent countless hours in subcommittee hearings, backroom discussion meetings, and virtual call with the stakeholders. We have debated, revised, and refined this bill carefully and intentionally. Now it is time to act. Let's end this journey with action. I respectfully urge your favorable consideration of House Bill 1555. Madam Chair, we can't undo what has already happened, but we can say it stops here. Thank you.
Thank you, Delegate. Did you want to testify, or are you here just for information?
I'm here in Deputy Secretary Kalyana Raman's stead. Sarah Case Heron for the Maryland Department of Health. He's caught across the street, currently testifying, I believe, as we speak right now. Mostly here to say of us too. We support this bill, which does have an assistive role for the Maryland Department of Health for the board, and believe that this is a strong bill.
I haven't had a chance to look. Is there a fiscal note, or you can do this within current budgets, or do we know?
Let me.
I mean, when I say fiscal note, I mean like the cost. Is there a cost?
Yeah.
I believe, at least for the Department of Health, there's not an initial cost. There is a sunset provision on some of the department's pieces, and we are looking to kind of assist with looking at the board's infrastructure, which is currently based on fees and things like that. But the part of the reason for the sunset of the Department of Health's piece and the use of potentially other funds is so that it can be reevaluated in a period of time to see if the Department of Health's role is still needed.
Thank you. Thank you.
I do, thank you. Delegate Bhandari, you talked about not wanting to, we've got to be sure we get something done on this, and I certainly respect that, and I know there was some really terrible situations that, at least one in particular that was talked about. It has been in the news a little bit. But I have some concerns about this bill because a few years ago, myself, colleagues of mine here that were here before, including people on HGO, spent a lot of time. We had the Board of Morticians was a very troubled board for many years, and there was a lot of friction between them and the industry. There were a lot of problems. There were problems with who the staff was. There was problems with a number of issues. And over a period of years, we made a lot of reforms, and we got a good board together, and that was working. And now there's been all these vacancies. And did you guys in the discussion, why are there still vacancies on the board? Yeah, feel free. Whoever wants to answer.
I could not speak to that because the board is independent, but we can look to maybe have the board respond for the record.
Yeah, because I think, number one, if we don't have a board that is fully functioning, that's a problem. And I'm not sure why apparently there's been some vacancies for a while, is my understanding. And if I don't have that whole story and somebody else is watching, I'm happy to be corrected on that. But my understanding is we have some vacancies there that need to be filled. So that's the first thing. The second question I guess I would have is I've had some folks raise the question to me about the difference between having the State Board of Morticians overseeing funeral homes, which is appropriate, and crematories, which might be better fitting under the Office of Cemetery Oversight. Can you, because I think one of the real terrible issues that was in the news was a crematory, not a funeral home, although does that ring a bell, or can you comment on that?
Yeah, thank you. So these are the independent board, and I reached out to the Board of Mortician. I could not I could not get answer from them. So they might have a concern. I can get back to you, but definitely I do support that philosophically here, but I would have to talk to the Board of Mortician and funeral directors.
And I'm sorry to interrupt you. Why are they not here testifying? It's not, and it's your bill. I mean, it's not your fault. I just mean, do we know, did they testify in the House, the Board of Morticians?
They did. I believe it was because this one was, there was no opposition that we were aware of. So we were just here for the Department of Health side.
Understood. Okay.
Yeah.
No, I'm sorry. Please go ahead.
And your amendment, I'm very clear and I'm very much open. I met with the Morticians about the amendment that you are talking about. And as long as we could pass this bill and we can give that respect to the family, I'm open to that. But it's the committee will, which directions the committee want to go. Okay. I don't have the objection.
Okay, I understand. Thank you. I mean, I think we're all in agreement on making sure we take care of the issue. I'm just had a lot of folks raising concerns about a couple things. So but I understand time is short. We want to make sure we try to take care of it. Appreciate it. Thank you.
Senator, they did have, at least, I don't know if they testified orally, but they did have written testimony in the House with amendments. So, yeah, thank you. Senator Jackson.
Madam Chair, in your testimony, Delegate, at one point you mentioned announced visits, and then you said something about unannounced visits. Which, for inspections?
Inspections, they have to, this bill requires twice yearly unannounced inspections.
Okay, unannounced.
Unannounced.
Okay. And also, was there some consideration to utilizing the county health departments to oversee this versus the state?
You want to speak how it works?
I don't believe that was discussed. I think that the logic of the current piece was that it was similar to some of the assistance that the Department of Health has provided with the Board of Nursing, and so that was the logic of those pieces.
I mean, do you think it would be better served to have the local jurisdiction health departments versus the state?
I can bring that back to our team and get a response on that.
Right, thank you.
Do I have any other questions for this panel? Seeing no questions, we are going to bring up favorable with amendments, Christopher Boggs and Walter Nathan Malloy, Jr. Thank you, Delegate.
Thank you.
Good afternoon, Madam Chair, members of the committee. My name is Christopher Boggs. I am a licensed mortician and a registered crematory operator here in the great state of Maryland. We are favorable of the delegate's bill. We just ask that there be some common sense amendments that are made to it. As brought up, as far as crematories are a final dispensation location, just as if you were to go into a cemetery. Once the funeral director drives to the cemetery, gives the burial transit permit to the cemeterian, the body is then in the possession of the cemetery and their responsibility, which is over the Office of Cemetery Oversight. The Office of Cemetery Oversight currently oversees very few crematories. They have a fully staffed board. They investigate their own complaints. So why not unburden the Maryland Board of Morticians that's currently understaffed and overburdened, and have the crematories fall under that oversight? That's all we're asking. That's what we're looking for, and we hope you would take that into great consideration. Happy to answer any questions you may have.
I just want to ask if you've put that request for an amendment in writing. Have you
I
done that?
believe so.
Okay, thank you.
Good afternoon. My name is Walter Nathan Malloy, Jr. I'm an attorney and lobbyist for the Maryland State Funeral Directors Association. We've worked at great length with Mr. Bendari's office and other delegates to amend the bill. We participated in the subcommittee hearing to make certain amendments to the bill. Specifically, the bill originated with statements about violations, and the statute was unclear as to what exactly constituted a violation, so we asked for an amendment. And in subcommittee, the attorney for the subcommittee proposed language to remove violations in place, and they would publish disciplinary action by the board. And everyone accepted that, myself included, but when the bill came out of subcommittee, it still had in there the word inspections. And the problem with that is we were trying to avoid the issue of the statute and the regulations speak to deficiencies as a result of an inspection. The statute and regulations also say that a licensee has the opportunity to cure a deficiency. And it was very important that the publication of a deficiency, which can be as minor as not having the right paperwork at the time of the inspection to show the inspector, because they are unannounced, would not appear on the state website indicating that somehow the crematory or the funeral establishment had done something wrong. After the subcommittee went to vote and crossover, and the bill appears as it is now, still has the word, I believe, violation in it. Delegate Bendari has graciously agreed to remove that and place in the language, but I have yet to see the final version, the final published version, to say the date of last inspection. And we're fine with that as long as those amendments appear. However, there are certain issues that still remain regarding regulating reduction facilities and crematories that have been added to this bill but do not exist in current statute. And therefore, we've proposed in our amendments that the entire statute needs an overhaul to include crematories and reduction facilities to make sure it's consistent with this new language being proposed in House Bill 1555. I've submitted my proposed amendments in our written statement, and I'll take any questions at this time.
Thank you for submitting that.
Thank you.
Your request. Do I have any questions? Senator Reedy.
Can I just, thank you, can I just drill down? So the issue about deficiency versus inspections versus, I have some notes on this, but I'm trying to be sure I understand. So what you all would like to see is, what you're okay with, obviously, the last time you were inspected being on the state website. I think that's already there, right?
No.
No, but you're okay with the idea of having the last inspection be listed?
It was a compromise, yes.
Right. What you're concerned about is having deficiency listed when it could be something. If a funeral home has been violating and not addressed a deficiency in the timely manner, that's one thing. But if it's just listed that you had a deficiency could be, you know, you didn't have the right paperwork, or you had something in the wrong place that, you know, they say should be over on this side of the room or something like that. Doesn't mean that you had, you know, untreated bodies in a freezer or something, right? I mean, is that fair to say?
Correct. The way the statute is written, deficiencies only, well, it's unclear, but one can infer from the statute, that's a bad word to use, I know, but one can infer that once a deficiency goes uncured, the board will then take disciplinary action, and then it becomes a violation.
So it would be better for violations to be listed as opposed to deficiencies?
No, we'd rather it just be date of last inspection, no deficiencies, no violations. However, once it becomes a disciplinary action, we've agreed that it would then be posted as a disciplinary action.
Okay, disciplinary action.
A violation.
That's what you guys would like to see.
Yes,
when we have
that's
to decide
correct.
if we want to do that.
That's correct.
Okay.
Senator, is that all?
Yes,
Thank you. No, that's fine. Thank you.
Madam Chair, if you want, I want to clarify. Yeah, thank you. His amendment is currently in the drafting phase. We'll send that amendment. Yeah, we agreed upon that, and we are sorry that was the oversight, and we compromised that.
Thank you, Delegate.
Thank
We'll
you.
watch for it. Thank you. I don't see any other questions. Thank you for this testimony.
Thank you. Thank you.
That ends the hearing on House Bill 1555, and now we're going to go to House Bill 1502. I think do we have Delegate Wells, Melissa Wells here, or her representative? Okay, come on up. Jennifer Martin and Nina Thamilis from the Baltimore City Mayor's Office. Okay, thank you.
Good afternoon, Madam Chair, members of the committee. My name is Nina Thamilis, Director of Government Relations for Mayor Scott in Baltimore City, here to testify in support of House Bill 1502 on behalf of the city administration. Delegate Wells did introduce this on the city's behalf. This is basically a fix-it, clean-up bill. It is to address three things with our syringe services program statute. We were the first program established in the state, and the state law still reflects that we're a pilot program. So we're just trying to clean up the language, modernize the terminology that's used, and make a couple other little tweaks. So we do have Jennifer Martin, who's Deputy Commissioner for the Baltimore City Health Department, to provide a little bit more detail on those changes. But we just urge a favorable report for House Bill 1502. Thank you.
Ready? Thank you. Good afternoon, Madam Chair and members of the committee. My name's Jennifer Martin, and I serve as the Deputy Commissioner for Population Health and Disease Prevention at the Baltimore City Health Department, here today testifying in favor of House Bill 1502. As Nina mentioned, this bill amends the statute that established the Baltimore City Health Department Syringe Services Program, which at that time was named and is still called in the statute today the AIDS Prevention Sterile Needle and Syringe Exchange Pilot Program. Since 1994, the Baltimore City Health Department has been operating this highly effective program. Of note, in the year that the program began, 67% of new HIV infections were among people who use injection drugs. Today in Baltimore City, that number is less than 7%. Additionally, over the past 10 years alone, our program has been able to collect more than 10 million used syringes. After 30 years of successful operation, it's time for a review and update of the statute that established the program. This is a very straightforward and corrective bill that seeks to do three things. First, it amends the composition of and authority over the program's oversight committee. Currently, state agencies are required to nominate several members. The bill transitions this authority to Baltimore City, giving the city autonomy over its program while also eliminating unnecessary administrative burden. Second, the bill updates outdated language in the statute. Both scientific progress related to HIV as well as our understanding of language and its importance have evolved significantly in the past 30 years. Some terminology in the statute is understood to be stigmatizing and needs to be updated. Third, the bill removes reference to the program as a pilot, as we're clearly not a pilot program anymore. I'm happy to answer any questions about why the bill is important. Also, you have our written testimony, and I respectfully request you issue a favorable report. Thank you.
Thank you. Do I have any questions for this panel? You must have answered all the questions. Thank you very much for your testimony.
Thank you. Thank you.
That ends the hearing on House Bill 1502, and now we're going to go to Delegate Pam Gazzoni, House Bill 1315, vaccinations by pharmacists and health insurance coverage.
Good afternoon, Madam Chair and members of the Senate Finance Committee. For the record, I'm Delegate Pam Gazzoni. I represent Howard County's District 13. Today, I'm here to present House Bill 1315 regarding childhood immunization. As with several other health-related bills put forward this year, this bill is designed to ensure that Maryland law has, in law, the ability to continue to provide, in this case, as part of the minimum package of child wellness services, all the childhood immunizations, which to date are recommended by the Advisory Committee on Immunization Practices of the Centers of Disease Control and Protection. Data shows that vaccines are effective and safe for children. In fact, they represent one of the most significant public health successes in medical history. They have dramatically reduced the consequences of diseases that once devastated pediatric populations, such as measles and polio. Bottom line, vaccines have saved children from serious illness, hospitalization, and the long-term negative effects of disease. This, combined with the number of challenges that we are seeing at the federal level, and the challenges to the CDC in particular that have been in the media over the last several years, makes it vital that we identify an approach to ensure that the currently established immunization recommendations are maintained in Maryland. This bill, as amended and passed in the House, locks in the recommended vaccinations of the CDC's Advisory Committee as of December 31, 2024, or at a later date to account for any new vaccination recommendations by the CDC's Advisory Committee on Immunization Practices. The bill language is designed to ensure Maryland continues to cover proven vaccinations as part of its childhood wellness services. This bill does not impact current processes or regulations on how vaccines are delivered. Given the uncertainty and with the outbreak of measles currently taking place in the country, it seems both prudent and imperative that we maintain high levels of childhood immunization in the state. I request a favorable report on HB 1315. Thank you very much, and I'm happy to answer any questions.
Thank you. Do I have any questions at all for Delegate Senator Reedy?
Good afternoon.
Delegate Gazzoni, great to see you.
Nice to see you.
Some of the bill was heavily amended from where it started in the House, which happens. But concerned about a couple of things that I see here.
Sure.
One is we have this date of December 31st, 2024. Mm-hmm. So it's saying that consistent with federal statutes, rules, and guidance in effect on December 31st, 2024, or at a later date to account for new vaccines.
Right.
I know what, I can read between the lines. I know what you guys are getting at with this, but I don't understand, what if a vaccine gets removed from recommendations and we're saying, nope, we don't care what the CDC says. We don't care what the CDC says. Our law doesn't. Even if they say no longer do you want to do this particular vaccination for this particular age group, we said it was this way as of December 31st, 2024. I mean, are we concerned that that's going to be a problem? I know you're trying to avoid if there's somebody. I know what's going on, but I mean, legitimately there can be changes made. So how do we square that?
My guess is, and we haven't necessarily spoken specifically about that scenario, but my guess is that there would be discussions with carriers, with the Insurance Commission and Commissioner Grant at this point anyhow, and other interested parties with regard to why the decision was made to drop it from the federal list and whether or not the state felt it was important to keep it or not.
Is this bill all about insurance coverage, or is it It's just about health insurance and insurance coverage, correct? It's not about.
You'll see in the bill that there's some changes made in the pharmacy realm as well. But again, those are just with regard to the vaccinations on the list, not how or who gets to provide vaccinations.
Yeah, it
That
stays
doesn't
away
change.
from the issue of whether a pharmacist can give
Correct.
certain. Okay, it's not.
Doesn't
that's
change
not in
any
the
of
bill.
those rules.
Okay, and then I guess one other question that I was looking at here was this also mandates payment for future vaccinations, which wasn't in. Does it mandate payment for future vaccinations automatically, or only if the CDC recommends?
The change right now, these are all vaccinations. All these vaccinations. Senator Shetty, excuse me, Delegate Shetty's bill earlier today talked about the ones where there are no co-pays.
Right.
All of these vaccinations are in that bucket already.
Okay. But
So, matter of fact, some of the language that we use is parallel to what's in HB 974, which is Delegate Shetty's bill.
Okay, so it's already it would be the CDC recommended another vaccine that would still be in that same basket of no copay vaccines.
It would be handled the same
It just
way.
might be a substitute for another one or an addition to another one.
Mm-hmm.
Okay. Okay, thank you very much.
You're welcome.
I don't see any other questions. We do have, you had somebody signed up, Alea Horton? Okay. Do you
I
want
saw her earlier.
Do you want to come up? Was she, I thought she was on your panel, not?
I just signed up.
Okay.
And I thought this was sponsored.
So are
on me
you
until earlier
speaking for
today, so-
all the pharmacists today or just for yourself?
On behalf of the Maryland Pharmacists Association, sorry. My name is Aaliyah Horton. I'm the Executive Director of the Maryland Pharmacists Association. I'm here representing MPHA as well as the Maryland Pharmacy Coalition, which includes all of the professional societies in Maryland that include pharmacists as well, the School of Pharmacies and the student pharmacists, student government associations. So yes, from the professional standpoint. And so I'm here in support of the bill, and I just want to clarify that it's not changing anything within pharmacist scope or anything in the law of how pharmacists administer vaccinations. It's really just ensuring that the guidelines that pharmacists follow for adults as well as children's vaccinations are codified. And it's also pharmacist training requirements for vaccinations are based on the same schedule. So we want to make sure that it remains consistent. And so your constituents can continue to receive pharmacist-administered vaccinations. And if I could add one more thing, there was some opposition testimony, and all of it, in my review, is based on current law. We're not changing anything.
Thank you. We do have one opposition, Sarah Kuzak's virtual. Sarah, do you want to give us your testimony?
Good afternoon, Senators. Thank you for having me. I represent the Love Maryland PAC, and we represent citizens from across the state of Maryland. We did not oppose the bill in the House because at the time it was about payment to ensure that there would be payment for the childhood vaccinations, and we had no opposition to that. The bill has changed significantly. I appreciate the intent. Like Senator Reedy said, I can read between the lines. I understand what's happening, but it is very dangerous to set the CDC's ACIP schedule in stone. We all just lived through COVID, and there was a Johnson & Johnson vaccine that we were told to get in our state. I can remember the governor handing it out outside of Secrets in Ocean City. It was safe and effective. It's been pulled from the market. I'm going to give you a few other examples of vaccines that were on the CDC ACIP schedule that had to be removed because they were dangerous. In 1999, a rotavirus vaccine was pulled after injuring infants. 2000, the oral polio was discontinued. 2016, an intranasal influenza was discontinued. Gardasil, the HPV shot, has gone from Gardasil 4 to Gardasil 9. It went from 3 doses to 2. Right now, the CDC recommends 6-month-old infants get 3 doses of the Pfizer COVID vaccine within a 3-month period. And that applies to 3- and 4-year-olds who would be affected by this bill. That could change. This is a very new product for a new virus. We are still learning. The CDC could say a 3-year-old needs 2 doses. We don't want to miss out on that for our children. That could be very important. We don't have long-term safety studies on what 3 doses of the Pfizer vaccine within 3 months is doing to a 3-year-old, because the long term just hasn't existed yet. So I appreciate the intent of the bill. I think it's a solution for a problem that we don't have yet. And the state should wait till there's a problem and then create a solution. Thank you.
Thank you for your testimony. That ends the hearing. I don't see any other questions. That ends the hearing on House Bill 1315. Thank you.
Thank you.
House Bill 1208, Delegate Tiffany Austin, Public Health Prohibited Ingredients in Food.
Good afternoon, Madam Chair and members of the Senate Finance Committee. I am Tiffany Austin, delegate from District 24, here today to present House Bill 1208, which prohibits certain ingredients in the food we eat. For many years, the FDA has banned red dye in cosmetic products. However, it wasn't until earlier this year that they banned those similar dyes in the food we eat. There are additional dyes that have been considered harmful to us. California in 2023 passed a health bill that would prohibit those ingredients from being manufactured, marketed, and sold in the food products there. We introduced the same bill last year in the Health and Government Operations Committee. However, it was not sufficient time to make it out. So I hope that this year there's sufficient time that we can consider this. With the recent ban from the FDA and the current secretary's push to ban these artificial chemicals in our food, I do believe the timing is right. Some would say, why do we need this when it's the FDA's job? And I would say that with the federal government, sometimes things run really slow and we can be more efficient and proactive at the state, so we don't have to wait on them to do their job in order to protect our children and our most vulnerable populations from items that could be dangerous to their health. And so what I'm requesting, we did take one of the amendments in the House. Originally, the bill had language that would have required a warning label be placed on products until the ban went into effect. We have deleted that language from the bill. We've given an effective date of October 1st, 2028. That would give the retailers plenty of time to change their formularies to start using natural and more organic-based dyes in the food products that we're giving to ourselves and our children. And this has been already done in European countries and in Canada. And so the items that we're requesting, you can see in the bill, is brominated vegetable oil, which it helps to keep the citrus flavor from floating to the top of drinks. And some of these things just aren't necessary. And I think with the amount of time that we're giving the retailers to get to change their formulas, it should be sufficient to protect our population and to protect their business model. And finally, I noted in some of the opposition testimony that they are concerned about, they call it a patchwork approach to dealing with this issue. What I find interesting, however, is that last year when we did the baby food bill, they wanted to make sure that we were in line with California, which we did. Last week, they were here testifying on another bill, and they said, please align it. I believe it was Delegate Pruski's bill, and they asked the committee to please align that bill with California. This bill is aligned with California, so there's no need for a patchwork approach. And in fact, West Virginia just passed similar legislation. Theirs was actually more aggressive and banned more dyes. So I would be happy if the committee wanted to amend the bill to add all of the banned dyes and artificial ingredients that West Virginia just passed. I'm not sure that it's been signed into law yet, but I believe the country is just moving faster than our federal government, and there's nothing wrong with that. So I would ask for your favorable report, and I'm happy to answer any questions.
Thank you, Delegate Austin. Do I have any questions for the delegate? Seeing no questions, we're going to go to Kaylee Locklear, unfavorable.
Good
afternoon, Madam Chair and honorable members of the Senate Finance Committee. For the record, Kaylee Locklear here on behalf of the Maryland Retailers Alliance. So we are asking Maryland to stick to FDA dates for brominated vegetable oil, BVO, and red dye number 3. So I'll start with BVO. On July 3rd, 2024, the FDA issued a final rule to revoke the regulation allowing the use of BVO in food. The rule is effective on August 2nd, 2024, and the compliance date for this rule is 1 year after the effective date. So it goes into effect 8/25. The compliance date for this rule is to provide an opportunity for companies to reformulate, relabel, and deplete their inventory of BVO-containing products before FDA enforces the rule. With regard to red dye, on January 15, 2025, the FDA announced it will ban the use of red dye number 3, and this ban was based on the Delaney Clause of the Federal Food, Drug, and Cosmetic Act. Manufacturers who use red dye number 3 in food and ingested drugs will have until January 15, 2027 and January 18, 2028, respectively, to reformulate the products. So it's interesting because the bill takes effect October 1, 2028, after the FDA will have the full ban in place. So it's not necessary. FDA says that propylparaben and potassium bromate are under review. We would ask you to let the FDA do its job so that Maryland does not supersede the FDA's authority. And we do appreciate the sponsor and that length of time, because we really do, if you all decide to move forward with those 2 ingredients, need 2 years to reformulate with retailer sell-through. So with that, those are our concerns. I'm glad to answer any questions the committee has.
Thank you, Kaylee. Can we wait for the virtual unfavorable, and then we can have questions for both?
Sure.
So Jennifer Gardner, if she's on. Okay. Hello, Jennifer. Unmute and give us your testimony, please.
Good afternoon. Thank you so much, Madam Chair, Vice Chair, and Finance Committee members. Jennifer Gardner on behalf of the National Confectioners Association. While we very much support a rigorous post-market assessment of food and color additives and a strong food safety system, we believe that House Bill 1208 would exacerbate a concerning precedent for state-specific food ingredient restrictions, and we respectfully oppose the legislation. As heavily regulated food manufacturers with national distribution networks, our members must follow a unified federal standard operated by FDA. Different laws in all 50 states would severely disrupt the economy and our existing food supply chain, posing a challenge to states like Maryland that rely on a strong interstate commerce system. Since similar legislation was considered last year, as Kaylee mentioned, 2 of the 4 food additives included in House Bill 1208 have now been revoked by FDA and will be phased out of the food supply, making this particular legislation very duplicative. And as also noted, brominated vegetable oil as well as propylparaben are currently under FDA's review. FDA last year undertook a substantive reorganization to create a new unified human foods program, and that will enhance the agency's focus on the post-market review of food additives and colors in the food supply. The new federal administration is also working swiftly to address food ingredients and recently launched a new commission that's tasked in part with assessing certain food ingredients using rigorous and transparent data. And this report is set to be released in just 2 months. Supporters of state food and color additive prohibitions allege that FDA is not capable of keeping the nation's food supply safe, so states must act. However, recent agency actions refute this narrative. FDA is the rightful national regulatory decision maker and leader in food safety, and it's crucial that states continue to allow FDA scientists, toxicologists, and regulatory experts to drive food safety determinations in the U.S. In lieu of pursuing a state approach, we urge you to support a unified federal standard and urge an unfavorable report. Thank you.
Thank you, Jennifer. Do I have Senator Ellis?
Thank you, Madam Chair. And Kelly, good to see you.
Good to see you, too.
So I'm interested in your opposition to this bill.
Sure.
Is it you're in favor of getting rid of bad chemicals and bad ingredients out of food, but you're saying wait for the federal government to do it?
So the federal government, for the first two ingredients that are referenced in this bill, are actually going to preempt the date that's in here, which is why it's just not needed. I'm not really sure what that accomplishes with BVO and red dye number 3. The other two ingredients, as Jennifer mentioned, are under review, and there's a report coming out in 2 months. Their scientists are looking at it in depth, and so we would ask you all to wait and look at that review before moving forward and banning those products.
So you're saying that you're in favor of getting rid of those bad, dangerous things, but let the feds do it uniformly.
The FDA
Is that a good summary?
Yes, the FDA does a thorough review. They have scientists that are looking at it, and we really need to take that into consideration.
So I'm listening to you, and under maybe the prior administration, I would say, yeah. But under this administration, firing many scientists, many people at FDA, do you really believe they'll get to this?
So I would say the first two ingredients under this administration have been banned. So they are doing their job still. And that report, despite what administration it started in, is coming out, and that's what we really should be looking at.
Yeah. So you have confidence that even with all those hundreds of FDA and scientists.
This has been years of review that will come out.
No, I'm not talking about prior years. I'm talking about currently.
Yep. All of that study started before the Trump administration.
Yeah, and so a lot of that is being decimated by this administration. I mean, if you don't have the scientists to do it, if you don't have the regulators, people to do it, then, I mean, I guess we have different opinion. So, which here it's allowed. but if the state does it, well, what's wrong with that? Because, you know, I go overseas. I go to Europe.
Sure.
With France or England, and been there recently. Go to McDonald's, right?
Sure.
I love McDonald's. I go to McDonald's, and it's like a different McDonald's.
A Big Mac? Or?
Well, I won't get into specific ingredients. I mean, food items. But it's like a different McDonald's in Europe than when we have here, right?
Sure.
The food is just very different because the European Union, they really ban a lot of these things. And they can't just send a frozen patty from here to there.
Sure.
You know, it's like there's no way. They reject it. And so they have different formulations, much more wholesome, healthier, like a different restaurant. It's like you don't recognize it really. And so if they can do it over there, why can't we do it here in Maryland? And why can't we be the leaders in getting rid of these bad things in foods and, you know, have other states follow us to really do that? Because we are a big market in Maryland.
Sure.
Believe me, McDonald's will not shut down shop here. They won't. You know, Burger King, I don't want to pick a McDonald's, but Burger King, any of them. I mean, this is too big a market. So why can't we be leaders in just insurance to make sure we protect our citizens and especially our young ones who love their Happy Meals and their other
Our industry
kids.
certainly cares about the safety of food products. We do not want to cause harm to our consumers in any way whatsoever. But we do believe that there should be scientific, factual studies about those ingredients, and that's what this decision should be placed on.
All right. Well, thank you for your answer.
Absolutely.
Appreciate you. Thank you, ma'am.
Thank you, Senator. Do I have any other questions for either of these witnesses? Seeing none, that ends the hearing. Thank you very much for your testimony. Next, we are going to go to House Bill 1148. Delegate Wyvil's here, and that you don't have any witnesses with you. House
I
Bill
do not. I want to
1148.
keep this short. So
Nice to see you on that side, Delegate Wyvil.
Yeah, you've spent all your time in our committee. So anyhow, Chair Bidle, honorable members of Finance, it's good to be with you. I'm Delegate Wyvil. Please present House Bill 1148. The bill simply provides that an insurer may not use a prior lapse in coverage not attributable to losses or claims history as a basis to deny coverage. A property owner, for whatever reason, may choose to self-insure. It might be to perform repairs. It might be for personal beliefs. Or a carrier may have chosen to exit a line of business and the insured is delayed in finding alternative coverage. None of these scenarios should preclude an individual from obtaining coverage again if the denial was for reasons other than loss or claims history. After the bill was heard in the House and after meeting with representatives in the insurance industry, the bill was amended to apply only to homeowners or renters insurance, and also to allow the insurer to require an affidavit stating that the applicant did not incur a loss during the prior lapse in coverage. I am receptive to further amendments which have been brought to my attention just today, including limiting the number of times one may incur a lapse in coverage, the length of that lapse, and requiring the statement or affidavit to be written. That actually was the original intent, but it was an oversight in the amendment. I ask you, is it fair that coverage is denied just because a property owner, for reasons other than loss or claims, chooses to self-insure for a period of time? Is it fair coverage is denied simply because the broker took too long to find alternative coverage when a carrier chooses to exit the market? Is it fair coverage is denied because a property owner bought one of those handyman specials at auction and needed some time to complete the needed repairs? For the fiscal note, the legislation is not anticipated to materially impact state or local government and have minimal impact on small business. The bill passed both the committee and the House by unanimous vote, and I thank you and ask for a favorable report on House Bill 1148.
Delegate, thank you for your testimony. Do you have any questions for Delegate Weibel? Thank you very much. Thanks
Thank
for
you.
the amendments on the bill. Next, we have unfavorable, Robert Enton, Bryson Popham, and Nancy Egan.
Good afternoon, Madam Chair, members of the committee. Bryson Popham appearing before you on behalf of the Maryland Association of Mutual Insurance Companies in opposition, reluctantly, to House Bill 1148. I say that because, as noted in my written testimony, I am unaccustomed to taking a position on a bill in one house when I didn't do so in the other house. And I met with the sponsor of the bill. That's noted in my testimony. I met with the sponsor of the bill today and expressed that regret to him. We had a very cordial conversation. Some of his testimony about potential amendments came out of our conversation. I have no problem at all with what Delegate Weibel has told you. He has a set of hard facts, difficult facts, and I respectfully suggest that this may not be the right approach to do that. Some of the problems can be repaired by amendment. He mentioned some of them. What if there are multiple lapses, for example? How long should a lapse be? But most important, it is true, and Madam Chair, I think you understand this from your experience in the industry, the presence of a lapse in coverage is an underwriting factor that some carriers use and have used for many years. And I think it would be disruptive, I think that's the right word, to the orderly underwriting of homeowners insurance in the state if this were to pass in its current form. Again, I understand Delegate Weibel's situation, and it's a tough one. I'm not sure we can fix this bill, but if that's the desire of the committee, I will work with you to do so. Thank you.
Good afternoon, Madam Chair and members of the committee. My name is Nancy Egan. I represent the American Property Casualty Insurance Association. We write 71% of the property casualty market here in Maryland. The language of the bill that is concerning is the word choice of the insured. Our concerns are in the situation that was once described is one thing. A carrier has left the marketplace and the insured is looking to place coverage elsewhere. But there's other additional situations that are not as favorable. In those situations, we're talking about whether a homeowner or a renter is required to keep coverage in place. They have a mortgagee on their policy. They're a renter and their landlord says you need to add us on as additional insured. You're in a condo building and your condo association requires you to have insurance in place. You get the insurance, and as soon as you get it and meet the requirements of your board, you then let the policy lapse. Then when they find out that you let it lapse, you go to get coverage again. You let it lapse. Once you provide evidence again, you let it lapse again. These situations are very similar to what you see in the auto market, where they get the coverage, they let it lapse, they get the coverage and let it lapse. And for those situations, we're very concerned that an insurance company who incurs a lot of cost every time they write a new policy would not be able to consider the fact that these insureds are doing this type of behavior. And for those reasons, we're concerned with the bill. Thank you.
Thank you, Madam Chairman, members of the committee. Robert Enton on behalf of the American Property Casualty Insurers Association. And with all due respect to the sponsor of the bill, I think that the bill really is problematic. I've represented the property casualty insurance industry here in Annapolis, I guess, for roughly 30 years. I've never in all that time, and I don't think any of you in all that period of time, have had a complaint about the fact that this is one of many factors that a carrier looks at in deciding whether or not to insure someone. You know, we have a very, very robust, effective insurance administration, and they are charged by the General Assembly and by the statute to make sure that an insured, I'm quoting now from 27501 of the insurance article, that an insurance or insurance producer may not cancel or refuse to underwrite or renew a particular insurance risk or class of risk wholly and partly for any arbitrary, capricious, or unfairly discriminatory reason. And everything that we have in a policy and everything that we review in making a decision whether or not to insure someone is subject to review by the Maryland Insurance Administration. Now, I'm not aware, no one's ever come, usually sometimes if we get complaints, if the MIA gets complaints, and they know that it's one of the carriers that's part of our trade association, I get a phone call about it. What about this? What about that? But this is just one factor that's looked at. And it's, to my knowledge, it's happened in one case. Now, maybe you all have had other complaints about this, but it's a factor. It can't be discriminatory. It has to be actuarially sound. And it's one factor that a carrier makes. And looking at the language in the bill, once again, with all due respect, it says based on, may not deny coverage based on a prior lapse in coverage. Is it just, you know, one lapse, 2 lapses, 10 lapses? I mean, I think that if this bill were to pass, it would need a lot of work. And in its present form, we'd recommend an unfavorable report. Thank you.
Senator Ellis.
Thank you, Madam Chair. And I was wondering how you would explain, and Nancy did a great job explaining, I understand someone gaming the system like that, and that was really really good to understand. How about someone who is not gaming the system, and someone, say, have a home and they pay off the mortgage and they thought they can be self-insured for a while, and then they decide to get insurance again. Should someone like that who's not gaming the system, but just, should they have an opportunity to, and I was asking Ms. Nancy, I think I'm allowed one person.
Let me just say this, that once again, I would emphasize that this is one factor which some companies look at. I'm not aware of any carrier that the only thing that they look at is this in a decision whether or not to renew. They're required by law to send a notice to say we're no longer, you know, writing up insurance. If you want to look someplace else, you know, you have a time frame to do so. And this is all subject to regulation by the Insurance Administration. But I think it's a fair factor that gets looked at. The question is, it's just one factor in many, and it's got to be approved by the Insurance Administration.
Thank you. Madam Chair, can I redirect to the person? So, Nancy, I mean, you explained it to us. So that scenario which I set up earlier, I mean, what do you think about that? I mean, you talked about someone gaming the system back and forth, and I definitely understand that, you know, you don't want that to happen but how about someone in that scenario become self-insured, paid off their house, become self-insured? Would it be fair to, if they want to get back in the market, for them to not be discriminated against?
I would have to check with my members because it's not very often that people go uninsured for long periods of time. I think in a situation where your carrier non-renewed because they've left the marketplace and you're trying to find a different market, that's a situation where, especially if it may be a situation where it's a secondary dwelling and now you're looking for a secondary dwelling and you can't find the coverage. That's one situation. If you choose to go uninsured, if a carrier would like to look at that as factor among the many factors, this bill would prohibit that. I don't think being in the market and saying that you've been uninsured is the only thing they're looking at when they go to underwrite your policy. They're going to look at the age of your roof, your repairs, a bunch of factors, and this would just eliminate one of the factors that they may consider.
So you're saying to direct answers, you'll check and get back to me?
Yes, thank you, Senator.
Yeah, thank you. Appreciate
Thank you.
that. Thank you. Thank you, Madam Chair.
Thank you. So I just want to mention one thing. I understand the issue with automobile insurance because in Maryland, it's the state law that you carry auto insurance. So if you've let it lapse and you go to a carrier who says, we're not going to insure you because you've been without insurance, well, you broke the law. You're supposed to have insurance and you didn't. And a lot of things can happen with auto insurance that turn out later to be a claim that happened in that lapse period. But homeowners insurance is a little different because it's not the law, and sometimes, as the delegate testified, a company pulls out of the market, which happens frequently on the Eastern Shore, and then you have a lot of trouble finding insurance. Not that you can't, but you have trouble. So, Mr. Popham, you look like you'd like to answer that, so thank you.
If I may, Madam Chair, and again, I thank Delegate Weibel for the opportunity to discuss this bill with him earlier today. He has difficult facts, that being one of them. He had a lapse and his carrier left the market. I asked him, first of all, do you want to reinstate coverage with your carrier or do you want to get it from another carrier? He said, I can't reinstate it because they left the market. That's unusual, but it's a fact. So there are at least a couple of other options that he has right now. He may not like them, but they are options. One is the JIA, and as I said to him, I need to find out. I don't know right now. I believe that there's condo coverage eligibility in the JIA. I believe that to be the case. You'll remember, Madam Chair, that we had this lengthy discussion on Ocean City mobile homes and how to cover them because there was no market for them either. So that would be one place. And then, of course, there is the excess and surplus lines market. Now, you don't want to go to the E&S market, as you well know, Madam Chair, because it tends to be more expensive, coverage may be more limited, but it is a market for coverage. So those are two options that one of which I'm sure exists, and I think both of them may exist.
Can you get back to me about JIA and the condo question?
I certainly can.
Can you also find out if it covers liability? Because I seem to remember that there was no liability coverage with JIA.
I'll ask that too.
All right, I appreciate that answer. Thank you. Do I have any other questions for this panel? Senator Ellis?
I'm not familiar with JIA. What is JIA?
It's the Joint Insurance Association. It's really kind of the high-risk pool for property.
Is that a state?
Did I describe that well enough?
Yes,
gentlemen?
ma'am.
Okay.
And
That's
Nancy?
a state agency or?
It's
Quasi.
Yeah, I believe it is a quasi-public fund. I think that's the correct structure for it. It is something that exists, I believe, in every state. It's where people go when they can't get homeowners insurance. And in fact, in California, it's called the FAIR Plan. If you read about California homeowners insurance, you read a lot about the FAIR Plan out there.
Okay, great. Thank you.
Thank you all for your testimony. That ends the hearing on House Bill 1148, and now we have House Bill 321, Pharmacy Benefit Managers. We have Delegate Kipke here with us. Delegates, do you want me to bring up your panel?
Yes, please.
Okay, Michael Patty, Callie Locklear, Alea Horton, Brian Hose. Please join the delegate at the table.
Thank you, Madam Chairman. Great to see you and the esteemed members of the committee. This bill, House Bill 321, passed the House Government Operations Committee, Health and Government Operations Committee 21-0, the House of Delegates 137-0 earlier this session. It's, I think, the third time you have seen it. There's a cross file here in your committee with Senator Lamb. And I'm going to do two things. One, I'm going to explain how the bill helps certain people, and I'm going to do that by explaining what the bill does. And having done these PBM bills for years, I can tell you this is the most confusing because if you start reading the bill, it talks about purchaser versus carrier, and your eyes can go sideways, and some very intelligent lawyers came up for that language. But I'm going to try to make it simple to understand. Over the last 20 years, the legislature has passed largely unanimous bills that sought to resolve problems in the pharmacy. They sought to establish some guardrails between the PBMs and the pharmacies. Over the years, we have negotiated those bills between those parties and come up with a scheme to try to create some guardrails. We used to believe that we could only impact the individual group market, a very small percentage of policies in the state of Maryland. But the Supreme Court wrote an opinion in response to a case called Rutledge versus PCMA that was written by Justice Sotomayor that was and joined by her colleagues with no dissent, saying that we can pass laws that regulate PBM policies as long as we don't interfere with their plan design. And so several years ago, we passed a law through this committee in the Senate and the House that expanded the protections of the laws that are on the books beyond that individual group to the entire book of business as it relates to the rules around reimbursement. I don't even want to bring it up because it's tedious. GER, all these different schemes that PBMs use to reimburse pharmacy. We created guardrails around that in response to complaints from our constituents and community-based pharmacy. And so since then, we have not heard a peep about costs going up for anybody. Not a peep. However, here today, there's an enormous amount of opposition from certain parties that have come out against this bill that does not at all involve reimbursement. Let me explain. This bill at its core helps consumers, union members, employees of business, and it helps create some simple guardrails for pharmacies. What are those aspects of the bill? The first is what I call the gag rule. Currently, if a union member goes to a pharmacy and to get a prescription, and the pharmacist knows that if they pay cash, contracts disallow that pharmacist from telling the consumer, the union member, the patient, that you don't have to pay $80 for this. If you pay cash, it's only $12. That's what the first component of this bill does. It empowers the pharmacist to have that right to educate the consumer that if they want to run it through a different program, discount plan, or just pay cash, they can save money. The second aspect of the bill is what I refer to as self-dealing. It extends to the portion of Maryland's existing law that says if you are a PBM, you can't only refer or require individuals to get their prescriptions through a pharmacy that you own without giving other options to. Third, we have a law in the books that says you can't reimburse the pharmacies that you own at a higher rate than the pharmacy up the road that's also in the network. Fourth, and this one is very important, we had to create language in the law related to audits of pharmacy. Audits are good. You catch things that aren't going right. Audits should be healthy, and there's nothing wrong with the audits. But we received, and you may remember if you were here, lots of testimony from pharmacists that they were being drowned in thousands of audit claims, and they were showing up unannounced on a Saturday when there was one pharmacist on site. So we created rules that said, you have to let them know when you're coming. And by the way, it's not a gotcha thing. These are documents that have already been, these are prescriptions that have already been dispensed that they're reviewing, so there's no reason to have an unannounced visit. And we created a negotiated number of prescriptions that could be audited. both sides actually weren't perfectly happy. One side wanted less, the other side wanted more, but it's a lot. It's a lot. And then lastly, we created rules for the PBMs. If the pharmacist disagreed with what they were being reimbursed, we created rules on how they can go about appealing the reimbursement and how the PBM had to respond, how long they had to respond, and that was all negotiated too. So with that, that's what the bill does. This, in my opinion, is a pretty simple thing, but there's a lot of opposition around it. I believe, and respectfully, misguided from certain aspects, and I understand why the PBMs wouldn't want additional regulation. The last point I want to make is that we do have a problem in Maryland with pharmacy. And it's not just the independents that you see here, and if you don't mind, Madam Chair, there's some independents here that if you'd stand to show your support, if you support the bill, these folks paid some money to be in their pharmacy to come here today.
I recognize the white jackets, delegates.
Thank you. We do have a problem with pharmacy, and it's not just these. I go to Mike's Pharmacy in Pasadena. I love it there. They know your name. They're busier and busier all the time, but they're not making any money, I'll tell you that. It's not just them. It's Giants Pharmacy. It's Costco. We've had, Food Lion killed their pharmacy program. So we do need to do more, especially this audit piece of the bill, I think is important to remedy some of the issues that are being experienced by pharmacy in our community. And with that, I ask for a favorable conclusion. Thank you.
Good afternoon again, members of the Senate Finance Committee. For the record, Kaylee Locklear here on behalf of the Maryland Association of Chain Drugstores. And I've said this before, but we truly come to you year over year because the current pharmacy business model with unregulated PBMs, it's not working. And as Delegate Kipke referenced, pharmacies are closing from 2022 to 23. 37 mass and chain stores closed in this state alone. Below-cost reimbursement, punitive PBM fees, clawbacks, take-it-or-leave-it contracts, and opaque steering and payer practices are the reasons our stores are closing, and legislation like what is before you today will make a difference. So the House, for a third year in a row, unanimously passed this bill and went even further by adding a work group that will report out specifically on where PBMs have shifted their profit centers to specialty drugs and steering. And I brought it up before, but in January this year, and Madam Chair, we talked about this, the FTC put out this very straightforward report about egregious PBM practices. That document, by the way, to eliminate confusion here, is a final unanimous document that was issued by the FTC. And I'll quote from it again. PBMs impose markups of hundreds of thousands of % on numerous specialty and generic drugs dispensed at their affiliated pharmacies. These are drugs that treat cancer, HIV, and other serious diseases and conditions. And my apologies, because I have been hunting this for you, and I finally have it, and I'm going to share it with the committee. But definitively, in looking at other states, Hawaii, California, Georgia, West Virginia, Louisiana, Tennessee, Delaware, Mississippi, North Carolina, and South Dakota, the rates of premium increases are lower in those states with PBM reforms. So I'll stop there. We urge a favorable report, and I will share that document with the committee. Thank you.
Madam Chairwoman, members of the committee, I am Brian Hose. I am the CEO of Epic Pharmacies. We have close to 200 pharmacies in the state of Maryland that we represent through one of the services that we offer. I myself am a pharmacy owner in Sharpsburg, Maryland, where I have a small pharmacy. It's no surprise that small pharmacy in a rural community is struggling. The zip code of Sharpsburg has less than 1,000 people. It's not a store that is there to benefit me extremely well financially. It's a service to that community and has been for a number of years. I don't keep it open because it makes me money. I keep it open because I care about that community, like the folks behind me in those white coats care about the communities in which they serve. I come to you today not to ask for a bill that's going to pay me more, but one that will help prevent some of the abuses that we see in the system. It's not fair that my PBM counterparts that own pharmacies can force people to use those pharmacies. It's not fair that they can pay themselves thousands of % more than they can pay me and my pharmacy to provide the same service to their patients. None of these things that we're seeing in this bill should raise costs for constituents. The PBMs have very aggressively told these union folks that that they will raise their rates if this bill goes through, and you better get your butt to Annapolis and make a stink about it. And that's what you're going to see. That's what you've seen with the written testimony, and that's what you've seen with oral testimony on these bills that you've heard. I would just go back to if you look at these provisions and take them one by one, as Delegate Kipke kindly did for you, these are not things that should raise costs. These are things that should level the playing field, make sure the PBMs can't pay themselves an outsized portion of the drug cost. The one that he did not mention that I think is especially interesting is the transparency sections, that the employer would get to see where the dollars go. I can't for the life of me understand why a union would not want to see where the dollars go. Certainly PBMs should be paid fairly for their services. They shouldn't be paid thousands of % greater than other pharmacies in the marketplace. And those employers that pay that bill should know where those dollars are going. They should want to know where those dollars are going. If they don't, I would question why. Thank you, Madam Chair.
Thank you, Michael.
Thank you, Madam Chair. Michael Patty here on behalf of the independent pharmacies in Maryland in support of House Bill 321. I want to continue to thank Delegate Kipke for championing this bill for us, as well as the Attorney General's office that weighed in support with written testimony, and the Insurance Administration with their technical guidance this year. I think everybody has taken my talking points already. I really want to focus on the very thick packet of written opposition. I've looked through what folks have said in their written testimony. They've used the same clauses, the same sentences, the same paragraphs, and the same 4 bullet points over and over in their testimony. And the one sentence that has continued to stand out is you've heard about what the bill at its core really does and how it helps patients and pharmacists is. It says, House Bill 321 has been supported by pharmacies for the sole purpose of increasing their remuneration. This bill is not just about reimbursement. This bill, as you heard, is about establishing that uniform framework when it comes to regulating PBMs and their auditing practices and their appeals practices. Additionally, there's these 4 points that have been repeated in a number of testimony that I'm sure you can easily see. It includes increasing prescription dispensing fees, altering the terms and costs of mail-order pharmacy dispensing, altering current networks, and eliminating protections from price gouging for specialty drugs. Specialty drugs are not included in this bill except for in the work group. That's abundantly clear. The brackets are not around specialty drugs. They are exempt from these reimbursement practices. PBMs can still direct their patients to specialty pharmacies for specialty drugs. We're not changing that in this bill. Altering current networks. I don't know why some of these employers wouldn't want their employees to be able to go down the street to their local pharmacy as opposed to trek across town to a PBM-owned affiliate, as well as mail order. Mail order is not included, to my understanding, in the bill. And then, we heard that while PBMs can no longer, in this bill, no longer reimburse their pharmacies more than what they reimburse an independent pharmacy, what we've seen in the commercial market is they've just lowered their own reimbursement as opposed to raising independent pharmacies' reimbursement. So, these points are repeated time and time again in this written testimony. I think some of this opposition is just misguided, and, we'd hope for a favorable report on the bill.
Hey, good afternoon, Aaliyah Horton, Executive Director of the Maryland Pharmacists Association. Again, we're the professional society for pharmacists. And this bill is really about transparency and consistency. And it impacts the overall pharmacy profession because pharmacists community pharmacy represents about 50% of the pharmacist workforce. And with these challenges that pharmacies have, whether it's community, chain, mass market, the PBM practices impact the ability for pharmacies to hire pharmacists to do the type of care that directly impacts your constituents. We have studies from the state of Maryland that shows that pharmacists' interventions and medication therapy and the work that they do has a return on investment of 5 to 1. And so we just want to ensure that we are protecting our pharmacies, protecting constituents' access to pharmacist services. And I just reiterate everything that the previous panelists said. Thank you.
Thank you. I have a question from Senator
Thank you, Madam Chair. And Delegate Kipke, you know, we've worked on these issues for many years, and you've been a real champion for it for our small and independent pharmacies, but also on just overall transparency and cost in the system. You know, looking at the PBM issue for sure. I've supported this bill before, and I still am very supportive of what we want to do. Obviously, there's all this opposition, and I'm asking you, but if somebody else on the panel is better to answer this question, it's fine. To me, the biggest issue is that people are concerned, and this is why I always had trouble with the bill here too, is the concern about, they say it's going to raise costs. And obviously now we're all sensitive to governments saying our costs are going up. Mm-hmm. Can you talk a little bit about why this won't do that?
Well, if it's going to raise cost because the union member didn't run an insurance claim through that system and paid cash instead to save a few bucks, I mean, I don't see how that raises cost. I sat down with the insurance administration. I said, what in here do you think would raise cost? And admittedly, it's a stretch, but you could say the part about you can't pay others less than you pay a pharmacy that you own less. Well, to be honest with you, I don't even really care that much about that portion of the bill because they just don't do it. They just pay themselves a little less to match what they're paying. They don't pay the guy down the street more. They pay themselves less. So we intended that portion of the law that we passed years ago to help the little guy or even Costco. But in reality, they just pay CVS less. I mean, that's who it is. It's CVS and Caremark, CVS Health. The aspects about the networking, they can still do mail order. You know, they can still limit their network. They just have to provide some options for people. If you actually read the text in the law book, we had to create rules for things like if you have a mail order requirement, you have to allow that first fill to be filled locally because it might be a life-saving drug that you need that same day. We actually that's what the law says. It doesn't say you can't create a network. You can create a network. You just have, we put in the law just some basic common sense around it. So I don't want to be disrespectful to the opposition, but I've also asked to meet with the unions. They do not want to meet. I have asked if it was worth talking with PCMA about negotiating or coming up with a compromise. The answer was no. So I think it's really just an all-out full court press to oppose a bill that further regulates an industry that needs to be regulated.
Do you think that, thank you for that, and do you think that some of the opposition is rooted in it's a bit of a, like, we just don't want change? I'm not talking about the PBMs. I'm talking about, like, you got different groups in here. Do you think not just the unions, but even some of the governments and business folks, is it that the idea of change is fear because it's an unknown a little bit, or?
I think this subject matter, Delegate Ted Sophocles told me when I first got here to be an expert at something that nobody understands. And,
good job, good job.
And that's why, and this just stumbled on my lap, you know, when I first got here because it was a hot topic.
Well, that's why I'm asking you, Delegate Kipke.
We had to put in the law that there's an 800 number for pharmacists to call when they deny a claim. They were just denying claims, and the pharmacists couldn't call anybody. So over the years, this thing has evolved. But if you look at the specific thing, the transparency thing is good for unions that are negotiating. We put in the law that they have to know if there's rebates. You know, we're trying to make it better for them, but because this is so this part of the law is so confusing, I think it's very easy to be told you're going to lose negotiating tactics if this bill goes through. Well, nothing in here harms the people who are paying the bills. If anything, it makes it better for them through transparency. It helps the consumer. In a major way, it helps the pharmacists with abusive methods of audits. You know, frankly, you know, I've tried to understand. I've tried to meet with. I wanted to ask specific, you know, talk through each piece of it. But like I said, I just think it's an effort just to kill a bill.
So your sense is that. Because I'm trying to figure out what we do here, because I think that the challenge is figuring out how to get some more reform done. And, you know, I've obviously supported the bill whole hog, but I don't get to decide by myself. So, okay. No, I'm just trying to figure out how to address the concern about cost without messing with the rest of the bill, but it's all kind of tied. That's what I was trying to figure out. But I mean, I wanted to give you a chance to kind of talk a little bit more about what some of the opponents have said. So I appreciate your answers. Thank you.
Thank you.
Thank you, Senator. Senator Matz.
Thank you, Madam Chair. We got two questions. The first one's for the sponsor, Delegate Kipke. Great to see you.
Too.
And I just wanted to check, because I was doing the laptop, review. So the vote in the House was 137 to 0. It was unanimous in the House. So I just wanted to make sure I was reading that correctly, to have all the opposition and then to see that vote come out. I know things can blow up pretty quickly over there, you know what I mean? And so
I've been there. Yes,
yeah,
thank you.
And then my next question is for Brian. Talking about this bill, well, first, ERISA versus non-ERISA. Can you define the universe?
So typically, ERISA plans are those protected employer-sponsored plans where they're considered to be self-insured, and those plans represent roughly 80% of the market in Maryland. The fully insured market is roughly 20%. So the bills that we have passed, this language is all in law right now for the 20%, and we haven't seen the market go crazy. We haven't seen anything that would even come close to what the PBMs are telling their clients is going to happen. I will be completely honest, these people are being lied to and they don't know any better. And that's exactly where they are. I can say it, Nick might not be able to say it, but I can say it. They're being lied to, and that is what's going on.
Okay. And from your perspective or from your testimony, does the bill just apply to ERISA or does it apply to the entire universe?
It expands it from the 20% of the fully insured market to the universe of commercially insured plans.
So it would bring that other 80% in. And then I know I've met with pharmacists. Our district has a lot of independent pharmacists, and we have a lot of these issues. Can you share a few specific examples about some of the inequities, the way this system kind of works on a day-to-day basis?
I mean, we have patients that just cannot use our pharmacy because they're mandated to go to a PBM-owned pharmacy. That's probably the most popular example that I could give you. We have lots of patients who come to us to fill a prescription, and they could be right down the street from us, but they have to go, another 10 or 11 miles to go to a PBM-owned pharmacy. That particular PBM-owned pharmacy will not actually answer the phone with a live person. You have to leave a message and hope for a call back within an hour. So if you have an urgent medical issue, those folks are still calling me because they can't get in touch with a pharmacist or literally anyone at that particular brick and mortar PBM-owned pharmacy down the road. And it's ridiculous that is the level of care that is okay, and that's what we're going to be left with when myself and the rest of the independents can no longer fund a business that isn't making money. I'll be completely honest with you. Last month, I infused $10,000 into Sharpsburg Pharmacy so that I could make payroll. That's insane. We're doing enough prescriptions that we should be able to provide a service to this community and God forbid, make a little bit of money at it for the work that we're doing. But that's where the marketplace is. That's where it is for these folks behind me. They're in white coats. We are at the bottom. If the state of Maryland does not make it a priority to help pharmacies, not just independents anymore, chains as well, you are going to continue to have pharmacy deserts. You're going to have communities without pharmacy. You're going to have that little old lady down the block from me who's calling me now to ask questions because her pharmacy won't pick up the phone, and I'm not going to be there to help her. That's where we are. So if we choose to take no action on the things that would help pharmacy for another session, I'm sorry, there will be more pharmacies closed. Yeah. There will be more little old ladies down the block who can't call Brian and ask for help because we're not there. That's where we are.
Thank you.
I guess a light one out. All right, I have a few questions. I've spent this whole interim working on workman's comp pharmaceuticals, so I have a little more grasp of what's going on with all the acronyms. But first I want to say, you can tell me that the opposition's being lied to, but I have to tell you, when I see this much opposition to a bill, it causes pause. And there's a tremendous amount of opposition, and it's not just the unions. So I want to say that. But Kelly, You talked about PBM reform in the states, other states.
Yeah.
Was it this particular legislation, like this ERISA bill, or was it other PBM reform?
Yeah, it's other PBM reform, so I have it broken down for you, so there's specificity in the document.
If you could share that with me, I'd appreciate it. I didn't think it was a lot of states that had, overturned the ERISA.
Yeah,
Because
it's
I think
different
there's other
components.
things we can be doing with PBM, and I'm not sure this is the rule. To the pharmacist, Brian, I have a great deal of respect for you, but because 20% of our market is what we can control, you assumed that the other 80% was ERISA kind of regulation?
No, of the commercial space. There's Medicare
Of the
as
commercial,
well.
because there's Medicare, there's Medicaid, there's
Absolutely.
federal employee, lots of federal employees.
Of the commercial.
And, I have federal insurance. I can go anywhere I want and get my prescriptions filled. And then there's the out-of-state companies who, no matter what we do, they're going to be able to continue to have their plans because they're located out of state. So it's not quite 80-20, but thank you for that comment. Do we have any other questions for this panel? Seeing none, thank you very much.
Thank you.
We are going to bring up only 3 unfavorable witnesses, so
Madam Chair, HGO's voting, so with your permission, I'd like to head back across the street.
of course.
Thank you.
I've spent a lot of time in HGO the last couple of days. Not as much as I did in ECM, though. Thank you, Delegate. We have Ray Baker, unfavorable, Michael Johansson, and Carrington Anderson. If you're here, please.
Good afternoon. Happy opening day to those who celebrate. Go O's. My name is Ray Baker. I'm the Maryland Director of the Baltimore, D.C. Building Trades Council, and we are urging an unfavorable report on House Bill 321. You guys have my written testimony, and so I will not belabor us with that specifically. One of the points that I would like to draw our attention to is that a number of our union benefit plans are interstate, and the value of them being interstate is that they cross state lines, and with this legislation, there would be unique and different policies across state lines with regard to union benefit plans, and that would complicate and make difficult some of the issues and challenges that are going along with having our prescription drugs. One of the things that is one of the biggest advantages of being a part of the union is the specific benefits, particularly our healthcare and benefit plans, that makes it attractive when we're out organizing. And so we ask for an unfavorable report because this change would complicate our ERISA plan. We would have inconsistencies across state lines, and although we've heard testimony to the contrary, we still maintain skepticism that there is a possibility and opportunity for increased prescription and dispensing fees, that there will be altered terms around cost of mail order dispensing, altering of networks, and protections from price gouging. And so we ask that those things at top of mind, and the coalition that you all will hear before you in both written and oral testimony, that you offer an unfavorable report on House Bill 321.
Thank you, Madam Chair and members of the committee. My name is Carrington Anderson with the Maryland Association of Counties, in respectful opposition of House Bill 321. House Bill 321 seeks to limit some of the cost-saving tools PBMs can use to negotiate on behalf of their clients, including county governments. Counties offer some of the best benefit packages to our employees, whether that's through negotiations, consultant, benefit managers, or requests for proposals. This bill will disrupt that process with negative fiscal impacts on counties and the public servants that we employ. It's a tough fiscal year for the state, certainly a tough fiscal year for counties. Counties are facing roughly $130 million in cuts and shifts in this state in the budget plan, and this would be one thing on top of that. I think simply put, counties are under a lot of pressure this year, and we try and provide good and generous benefits to our employees. PBMs are a tool that help us do that, so that really is where our concern comes in. Counties are in opposition to our to this bill. Our friends from the unions are in opposition to this bill. It's not every day that we're before you on the same page with our union friends on the table together. It's not just us, it's also MML, the Chamber of Commerce, MABE, LIUNA. I'm looking at a group of roughly 30 different groups in opposition. And lastly, I just want to point out that this committee heard House Bill 813 yesterday. It's a work group to study this very issue, to look at PBMs and ERISA. And I think there's still a lot of questions on this bill for the costs and benefits, and just would really respectfully urge the committee to look more at this study bill as well. And it's for these reasons we would respectfully request an unfavorable report. Thank you.
Mr. Johan.
Thank you, Madam Chair. I'm Mike Johansson on behalf of PCMA, and thank you for giving us this opportunity to testify in opposition. So ERISA was passed in 1974, the Employee Retirement Income Security Act. It applies to retirement plans as well as health benefit plans. When it was passed, it was to create uniform protections for employees who had those benefits that were promised to them. And at the same time, the federal government wanted to exempt those national plans from the administrative and financial burden of complying with conflicting directives from state and local governments. A state may not interfere with plan benefit design. However, Rutledge reinforced existing rules that said states could affect payment. If the state of Maryland wanted to mandate that pharmacies can receive $10.18 dispensing fee, you certainly can, but I think everyone understands the cost that that takes. So some of the things that were mentioned, gag rule is already in federal law, so this bill won't change that. Yes, it's in state law also, it won't change that. The self-dealing issue, which was actually choice of pharmacy, talking about which pharmacies you can go to, is clearly benefit design. If that provision is passed, you will likely see litigation over that matter, as there has been in other states. Audits. So the question about audits, that apparently applies to 20%. Are they still having problems with audits for the plans that aren't part of the 20%? Has there been one indication that they're getting Saturday audits because it is an ERISA exempt plan, while they're not getting an audit on a Saturday because it's a regulated plan? I didn't hear that. Rules to appeal reimbursement, it was another item that was mentioned. And again, I'm not sure that they've expressed there's been any concern. I'm not sure that MIA has said they've received any complaints on the non-regulated plans. Not one plan sponsor, not one, is on the proponent side. So it was mentioned about the study. We certainly support looking into this further. This is an issue we would like to resolve as well. It's not like we are just trying to say don't do anything. We understand. Last, just to correct a fact, the FTC report, if anybody looks on their phone and Googles FTC report on PBMs, it says second interim report. It is not a final report. Anybody can validate that. Thank you, Madam Chair.
Thank you. Do I have any questions for this panel? Senator Lamb.
Yeah, thank you, Madam Chair. I was just looking through the testimony, and I think, Mr. Baker, you referenced this as well. You cite that there are 4 points that may change if this bill were to pass. And just seeking a clarification here, because I thought I heard the sponsor say that this bill does not apply to specialty drugs. And I've been looking up and referencing the bill, and it's not amending current law, which applies to the reimbursement of specialty drugs, and that PBMs can still direct patients to specific pharmacies for specialty drugs. So I'm trying to understand why you contend that this would eliminate protections for price gouging for specialty drugs, and whether you would still have these concerns now knowing that the bill does not actually impact specialty drugs.
As referenced in the testimony, Senator, respectfully, it was the possibility of that being there, and that was a concern of ours, the probability or possibility. And while we've heard from the opposition that they suggest that it was not, that is still that maintains a concern of ours, and that I would think could be properly adjudicated through the work group to be ensured of all of that as we move forward.
And it is part of the study in the bill. So step one is to pass the bill, have it apply to all the ERISA exempt plans. Step two is page 13, study specialty drugs and whether or not that gets captured next year. So I think the concern is valid.
Potential concern, I guess, to your point. Okay, thanks.
Thank you, Senator. Senator Mount.
Thank you, Madam Chair. And Mike, good to see you.
Thank you.
And thanks for the testimony. I was interested, and you really didn't talk to this very much, but the issue of cost. You know, one side says this will raise costs. The other side says here in other states it's lowered costs. And I was listening to AFL-CIO talking about, well, this is a problem because of complexity that it would add, but it didn't talk about the cost to the members.
Yep.
And so I'm interested to get your take on cost.
So thank you, Senator. So the Maryland Association Boards of Education, in their letter, estimates that throughout their boards, their consultant advised them it could increase costs by 5 to 7%. I think the key issue that has the most potential impact on costs in the current bill is the choice of pharmacy language. I looked at most of the Big 7 county employee plans and school board plans. Most of them have some type of choice of pharmacy preference, and they also have, in some cases, mail order preferences, and this language would certainly have an impact there. And when you're looking at working with a PBM, and typically these systems have consultants that also advise them on procurements and how to pick a PBM, they look at options to reduce cost. And having a mail order option, which is permitted for ERISA exempt plans, it is not permitted with a financial incentive in the commercial regulated market. This is a way to reduce costs by saying if you need a 90-day maintenance med, you must get it through mail order. Or if you get it through retail, you have to pay a higher copay. So that financial incentive is allowed in school plans and county plans. It is not allowed in today's regulated market. And frankly, that means if you're in the regulated market, those sponsors don't have the option of trying to reduce those expenditures. So I think that's the glowing example of cost in this bill. The second one is the specter of specialty drugs coming in right behind it, which they've mentioned they want to study.
So, and I know you haven't seen the paper that was talked about in the first panel with showing where costs have been lowered in different states by changing the rules. And I haven't seen it either, so I really can't speak to it. And I didn't know if you wanted to address, if you're aware of any of the states that were mentioned or things that were there, if there's any comment that you have about that.
Thank you. And I guess what we did here was that was a result of different types of reforms, perhaps some of the reforms that Maryland's already done, right? So, but not necessarily because of this ERISA bill.
So some of them may have been effective.
Sure, and be happy to look at it.
Yeah. And then Carrington, for MACO, you know, the viability of pharmacy is a big deal in counties. And I understand the counties are looking at this based off of the budget, you know, where's their bottom line? Was there any consideration given to access to health care? I'll give you an example. In my district, if you live in Tillman Island, the nearest commercial pharmacy is a 40-minute drive to get to that pharmacy. Was there any consideration given to the access to care, pharmacies, the availability of care and things like that?
Thank you, Senator, for the question, and that is something that we consider, but I think when we're looking at our benefit packages, we're trying to figure out the best package that we can offer to our employees at the lowest cost for them, and to make sure those are thorough. And we believe with the cost-saving tools that we currently are using, that's how we do that. So I hear your point. I'm happy to continue to further look into that as well.
Thank you.
I have one question. I'm not sure who should answer it. I think Carrington. Well, you may or may not know this, but does every ERISA plan limit pharmacy choice, or do some plans allow you to go to any pharmacy you want to go to?
Madam Chair, if it's okay, I think that he might be a little bit better at answering that one.
Thank you.
So a plan sponsor can certainly say you can go to anyone, just like they could say you could go to any physician for your health care. Or they could say there's the preferred in-network reimbursement for your physician versus your out-of-network. they could do the same thing for pharmacy and perhaps have different co-pays, which would be the way to do that.
Yeah.
The plan sponsors make those decisions.
But we don't really know the details of the plan sponsors.
Everyone chooses something different. I mean, I think that's kind of the beauty of a plan sponsor working with their set of employees. If it's teachers, they may have different interest in prescription benefits versus railroad workers or police officers. And I think plan sponsors have the ability to set up a health plan, because most of the government plans, for example, and even some of the private sector, work with bargaining units. And when the bargaining unit's paying 25% through employee deductions, and the company or the government's paying 75%, they get to pick. And someone will say, well, if we have a limited specialty pharmacy network that you can only get through mail order and you have to do X, Y, Z, we can save this much money. Or if you want an open pharmacy, you can go anywhere, which, for example, the state of Maryland plan is very open. You can basically go anywhere. It costs more. And if the labor union and the government or the private company decide, yes, we'd rather have it more expansive, then they'll do it. Just like the same company could say, we only want an HMO, which is a very limited medical network. They could have that choice too, if that's the best way to save money.
I missed a hearing yesterday because I spent my time over in the House building, but there was a hearing about a bill, 2 hours. There was a hearing about a bill that was going to do a study on PBMs. I don't know if this is something that the study could include to find out how many ERISA plans really do limit pharmacy choice. That would be an interesting thing to know. Okay, thank you for that answer, Mr. Johansson. Do I have any other questions for this panel? Senator Reedy.
If I could ask from the union, did some of the things that you've mentioned, did you say that you guys have a consultant that you've worked with to give you some of these concerning issues, or who is informing you and your team about, your leadership team, about the potential negativity with this bill?
I did not say that, Senator.
No, it's okay. I was trying to remember who said it. Yeah, but
so we have a team with the Building Trades Council. The council is made up of 28 different affiliates, and so within that, our political team puts together our ideas and comes together. And this is what produced the testimony that you have before you and that I offer today.
did they rely on analysis? I'm trying to actually understand more about this whole issue. As you may know, I've been supportive of wanting to do something like this or this in the past. Obviously trying to suss out, we understand the concerns. We don't want costs to go up, but at the same time, there's, like it always is with this issue, there's seems to be a lot of disagreement between one side and the other. Yeah. How did your team get, like, who handles the health plan? Who interfaces with your PBM?
So, unfortunately, because there are 28 different affiliates, all of our locals interact individually. Okay. And so there's not the singular answer that would best serve what it is that you're asking for, because each of the locals can negotiate their own.
And they could, so there could be 20 or 25 or more different, okay, that's great. Yes. And then let me ask, if it's okay, Madam Chair, I'm going to assume it's okay to ask for Mako. Is that similar to what your counties, your county clients have? It may be different. Is there like a couple big providers that do all the counties, or is it could be 17 different ones?
Thank you, Senator, for the question. I think it varies really for counties as well. I know some counties work with local government insurance trusts, legit, different PBMs. I know MABE does. They have a purchasing collective that he could provide more information about, but it does kind of vary.
We just passed legislation this year. I'm assuming it's going to get through the House because I think it was kind of unanimous on both houses that tries to incentivize or at least have people look at insurance pooling. Would insurance pooling, would this be something that you counties could pool on this as well? Or it's okay if you don't want to get back to me, let me know. I'm trying to understand if there's a way. Part of this issue is finding ways to save costs but allow for more flexibility to accomplish the aims of this bill, but then also say, but if we pool, we may be able to offset any potential costs.
Thanks, Senator, for the question. Yeah, I definitely think that is something counties would be interested in. If you could tell me the bill number, it actually may be a bill that we supported, but I would have to check.
I'll get it to you.
Thank you, Senator.
Thank you. And if one last question, Madam Chair, I know I'm going down the line here. This one, yeah. From Mr. Johansson. So you mentioned, I think it was you that mentioned the consultant. So repeat that point. You guys had a consultant that did the analysis.
So the Maryland Association Boards of Ed actually identifies that they do a couple things. They have a pharmacy purchasing collaborative, so all the boards of ed can learn from the best experiences of the 24 boards
Sure,
of
that's good,
education.
yeah.
And they specifically identify that they use an outside entity, which is not a PBM, but a consultant, and they actually name it in the testimony if you want to reach out to them.
Okay.
Secondly, Legit, Local Government Insurance Trust, has a collaborative and a pooling for municipalities and other local governments, for example, some of the smaller counties on the Eastern Shore. So that concept of pooling and having a common understanding of how to negotiate, maybe issue an RFP, get a better deal from health plans as well as PBMs and dental plans and vision plans by bringing governments together, and also having the resources to hire a consultant to conduct that RFP and get advice on how to design a benefit plan.
So why would this bill that's good, and I think those are all great things. You got smaller populated counties, particularly. You don't want 9 different ones on the Eastern Shore. They can combine efforts, which is good. But they could still do that under this bill. So how would this bill hinder that and drive that cost issue?
The biggest change is the language related to choice of pharmacy, okay, which indicates that there are restrictions that there aren't today for those same local governments on creating more narrow networks with respect to certain pharmacy services.
So the feeling is if it says you have to at least discuss choice of pharmacy, but the bill, I guess, mandates that you have to offer.
No, it says that you can't limit pharmacy choice if to a pharmacy that the PBM is affiliated with. So that could particularly affect mail order or certain retail networks. And as they suggest they want in the bill through the study, is that could affect specialty pharmacy. And we all know that specialty pharmacy expenses are now far exceeding more than 50% of expenses in some plans.
I'm really, I appreciate this. This is good information. I know you and I haven't always, we've been at odds at times, but I mean, I wanted to understand, if we could figure out a way to incentivize or allow for more, the idea of the self-dealing is the problem. The concern is that PBMs are saying, yeah, if we say that we'll only limit, if you get rid of our ability to limit choice to this, then costs are going to go up. But the argument that the proponents would say is that the clients never really get to see the difference because they're only getting the ones that no offense, the PBM is telling them is better. So I mean, is there a way for us to safeguard against that, or would you argue it's already safeguarded? Or
I would assure you that I'll pick one of the largest counties in the country from near Washington, D.C., actually both of them close. They are very sophisticated purchasers, just like the state of Maryland is a sophisticated purchaser. One of the provisions of the bill the proponent said was it'll give transparency to plan sponsors so they'll know what people are being paid. Any plan sponsor has that in their contract today. And I'm sure the advisor to the MABE purchasing, pharmacy collecting practice is requiring those provisions in those contracts. You don't need this state law to apply to national ERISA plans and counties to tell them they have to have that provision in there. They know exactly. And if they want 100% pass-through pricing, they can mandate that too.
But what about the rest of the less sophisticated purchasers that also are relying on PBMs?
Which one are we talking about?
High employers, they may not know to ask that.
Northrop Grumman and Sienna that are national companies. Which employer is on the other side saying we need you to regulate us? We are exempt under federal law, but we want you, Maryland, to protect us because we're not sophisticated enough to protect ourselves.
Okay. Thank you very much. Thank you.
I think that ends all the questions for this panel. Thank you very much for your testimony. That ends the hearing on House Bill 321. Now the last bill of the day, House Bill 1144, State Public Transit Service and Stations, Exclusion for Assault and Bodily Injury. It's Delegate Jackie Addison. I'm going to call a few of you have a lot of support. I'm going to call a few up if that's okay. Okay.
Yes, thank you.
Michael McMillan, Cheryl Austin. T, I don't see you listed, but you're welcome to be here.
You don't see me listed?
What's your last name?
Pendleton. David Pendleton.
That's all right. He's there? Yeah. Okay. Okay. Thank you. I got to, oh, there you are. See, I don't know Miss David. That's the
I
problem.
know, she knows me as the train man, that's okay.
Shantice Robinson, did I call Shantice? There she is. And how about Brian Perry? Is Brian here? Okay, we'll stop there. Come on up, Brian. I think I have everybody. There'll be some more support after this panel, but.
Thank you so much.
Thank you, Delegate. I think this is your first time in our committee.
It is. It is. Thank you. And I just put eye drops in, so my eyes are a little blurry.
Pull your microphone a little closer for me and speak up a little bit, please. Thank you.
Can you hear me now?
We can.
Okay. Good afternoon, Madam Chair and members of the Senate Finance Committee. For the record, my name is Delegate Jackie T. Addison, here urging a favorable report on House Bill 1143, State Public Transit Service and Stations, Exclusions, and Assault and Bodily Injury. According to the Federal Transit Administration, a major event occurrence of an assault on a transit worker is defined as an event resulting in a fatality or injury requiring medical transport. According to the National Transit Database, last year in 2024, there were 33 major event occurrences of assault reported to the FTA from WMATA and the MTA non-major event data, i.e. no one had to go to the hospital, includes 191 physical assaults on transit operators in 2024 at WMATA, MTA, MARC, Ride On, in Prince George's County, the bus. The same data includes 204 assaults on other transit workers, i.e. transit station managers and employees. The reportable threshold for assault on transit workers, have grown 121 according to data from the NTD nationwide. The Urban Institute, however, puts that number at nearly 300%, from 168 events in 2008 to 492 events in 2024. This is a problem, one that is solvable with the correct policy in place. This bill will do just that. HB 1142 mandates the MTA, in consultation with WMATA and Labor, to convene a work group to create a rider code of conduct and implement a comprehensive internal safety program to strengthen protections for passengers and public transit operators that shall include ridership bans. House Bill 1144 will not increase incarceration rates, yet working conditions safer for transit workers and traveling conditions safer for passengers throughout the state. There is a vigorous amendment process. All the affected stakeholders weighed in, and the bill reflects this spirit of compromise. HB 1142 was passed unanimously in the House and co-sponsored by pretty much the entire House and E&T committee. I encourage the Senate Finance to give a favorable report. Thank you so much.
Thank you. David, would you like to go next?
Yes, ma'am. Chair Bottle and members of the Senate Finance Committee, my name is David Pendleton. I'm the Director of the Maryland Safety and Legislative Board for the Transportation Division of the International Association of Sheet Metal Air Rail Transportation Workers, SMART. Our members in the state of Maryland are employees of CSX Transportation, Norfolk Southern, Canton Railroad, Amtrak, and MARC. We are conductors, engineers, yard masters, switchmen, and utility workers. We are the train union. SMART's first responsibility is to ensure a safe working environment for its members. On their behalf, I urge a favorable report on HB 1144. Assault is a terrible crime that is perpetrated on its victims without regard for their race, sex, age, or religion. More often than not, assaults on conductors stem from us saying two small words: ticket, please. It is the simplest of our duties that generally causes the most issues. Often when this happens on MARC, the perpetrator is allowed to catch the very next train. Should it happen in the morning, should have happened in the morning, we would like to see them later in the afternoon on the same day, definitely the next day. HB 1144 would put a stop to this injustice. It would hold perpetrators of assault accountable for their actions by taking away the privilege of utilizing public transit services. Passage of this bill will send a clear message that the state wants a safer public transit service for its commuters and workers. This common sense legislation is passed in Virginia, Illinois, New Jersey, New York, California, Massachusetts, Oregon, North Carolina, Georgia, Illinois, and here locally in Montgomery County. It is time for the state of Maryland to join this list to make the commute to work safer for the riding public. Thank you for your time and consideration of our position. I urge a favorable report.
Thank you. Who'd like to go next?
Madam Chair, members of the committee, Michael McMillan, President Business Agent for Amalgamated Transit Union Local 1300, representing nearly over 3,000 employees of the Maryland Transit Administration of the bus, subway, light rail, in operations and non-operations. This bill here will help our frontline employees, those who that the public see first out there when they're having issues, personal issues of their own. But yet they want to, first people that they see are our frontline employees, and they take that out on them through assaults, through spitting, through hits, through sexual assaults, through verbal threats of death on our members. But they also do it to their peers who are riding in the public with them. But yet when they go through the judicial system and the judicial system fails them, they're back on the same transit, saying and looking in the faces of our members and saying, hey, look, I'm back again. I got away with it. And what do? We have a lot of repeat offenders who become more brazen in their acts when they get away with it once, twice, and 3 times, and there's no accountability whatsoever. And that's what we're asking for, that this be done here with this bill. And we are urging for a favorable support on HB 1144. And also, too, I have 2 of my members here today, in which I don't want to see any more of our members who go through the same thing weekly as the accounts that you'll hear today. It's saddening, disheartening, and as a leader of the union, I want to be able to say that, hey, Maryland stood by us and was able to give us a one step forward and I've been with the company for 30 years, and this is the strongest legislation that I've seen, in which I think also, too, that being an operator and being a victim of an assault in the past, that this is a step in the right direction and will help. Thank you.
Thank you.
Good afternoon, Madam Chairman and committee members. I'm here piggybacking on an incident that I spoke on in front of the committee with the encounter of a near tragic experience with a near-missed assault from a disgruntled passenger whose intentions was to inflict bodily harm. I urge for a favorable report on this bill. Thank you.
Much for your testimony. Shantice?
Shantice, yes, ma'am. Good afternoon, Chairman and members of the chair. My name is Shantice Robinson. I've been working with MTA for 8 years. I came in contact with a gentleman 3 different occasions from the time of July to October, where a passenger stole my property from off the bus, picked my drink up, drunk my drink. Police came, gave him a citation for him to go to court. 2 days later, I seen someone running for the bus. It was the same person. He got on my bus. I didn't recognize him because I only had that one encounter. He got on my bus. He looked at me. He reminded me. He remembered who I was. He wanted to know what I was going to do about him taking my things. What he said to me was, "You look like you seen a ghost." Because when he got on the bus, I was looking like, "Oh, this him. You look like you seen a ghost. I know who you are. You know who I am. I took it the other day. What you want to do about it?" He sat behind my seat. He watched me through the mirror. He seen me on the phone. He came up to the front, putting his hands all in his pocket, asking me, did I call somebody? At that moment, I started panicking. The MTA wanted me to stop the bus right there. It wasn't safe for me because that's not a relief point for us. It would have looked suspicious. I didn't know what he had on him. If he drunk my drink, if he stole my property, he remembered who I was. He could have got on and sat down, but he wanted to remind me who he was. I got to Mardorman. I had an anxiety attack, a panic attack. I had to go to the hospital. I never been through that experience before. Months later, the 3rd occasion, I had to go get a peace order out for this same particular person. 6 weeks of no pay. I had to go every week until he got served. I'm traumatized. I got anxiety. It bothered me. I had to see a therapist. He wound up getting probation. The judge gave him a year probation, told him to stay away from me, and he 3 weeks later he tried to stab her, the same person, and it's very frightening. I get torn up. I'm deep. It's like, wow, how they get. Whew, I'm sorry. It's just, we all have families to go home to. This is my safe place. I can't even safely do my job when I go to work because I'm afraid. My chest tightening up when I walk into MTA, and MTA is telling me their hands are tied behind their back, with these passengers being able to just get on and assault us. I'm a woman. I made no threats to anyone. I didn't disrespect anyone. I just want to come to work and safely do my job. And I'm just asking for an honorable favor in this bill.
We got one more person, and then we're going to have a question for you. Brian?
Thank you, Madam Chair and members of the committee.
What?
Sorry. Thank you, Madam Chair and members of the committee. My name is Brian Perry. I've been a railroader for 27 years of service. The last 15 years I've worked as a conductor both with Amtrak and MARC. I am urging a favorable report on HB 1144. While boarding passengers in West Baltimore Station stop, a man walked up to my fellow conductor, told him he did not have a ticket and that he was going to board the train, at which this point he was told he needed a ticket in order to ride. The man became quarrelsome, grabbed my coworker by the shirt, knocked him into the stairs of the train, and drug him into the train. I then grabbed him from behind, removing him off of my coworker, and together we were able to restrain him until he calmed down. Another crew member got help from the MTA police. We both sustained injuries and missed months of work. While he was arrested in this instance, charges were not pressed. This doesn't happen most of the time. Usually attackers are removed from one train and then they are allowed to board the next one. Imagine somebody walking into this building this afternoon, assaulting one of you or someone you care deeply about, and being able to come back later on this afternoon or this evening or first thing in the morning. It's pretty unimaginable, but it happens to us every day. This bill would ensure accountability. It would make these trains safer for us and the passengers. It will be a deterrent to would-be attackers, knowing that there are consequences for their acts, because right now, they don't feel that way. I am certain that everyone wants a safe environment to work in. This bill would do this for us. Thank you for your time, and I urge a favorable report.
Thank you. Senator Giles, see your light's on.
Yeah, thank you very much, Madam Chair, and thank you for this bill, Delegate. And I really sympathize with some of these stories. It sounds very frightening. I did just have one main question, but how does it work as far as enforcement? Let's say you ban somebody from being able to use a train. Like, how do you prevent that? I mean, are they effectively prohibited from buying a ticket? Like, how do you know, I guess, that person is prohibited from getting on the train? And are you feeling better? I know we previously told you.
I know. When we talked, I had to be masked up and electronic, right? Now, and when we initially put the bill in, the original bill language, we would have relied on a BOLO system. That's the be on the lookout notices that the MTA police puts out and that they distribute to all of us. Now that it has evolved through a very vigorous amendment process to where we're going to form a work group, that we're really proud of the fact that Metro is going to be included on this work group. We're going to sort through that problem. Metro is actually voting on their ban policy today, and it will be in effect for almost 6 months before ours is created. So that's an issue that we will work out as the work group. But initially, we would rely on BOLOs, at which point we would have called the police, and then the police would have came and removed that banned passenger at that point. But I'm imagining it's going to be a little different now that the work group is formed. That'll be an issue that we work out together.
So it would be like a picture of somebody's face or something that, like, this person's been banned. And I mean, I guess the other thing I'm wondering too is this, I mean, I'm sure some of these details would be worked out later, but I mean, how often does this happen such that you call it be on the lookout?
Yes,
like,
ma'am.
Is it like a binder or how can you just be prevented from buying
It
a
would be a
ticket?
notice about this big.
Okay.
It would have the person's picture on it, and it would say, be on the lookout for this person. They are banned because they did X, Y of assault, and they're banned for this amount of time. And that notice before would literally be emailed to us on Mark, to the MTA. They're posted in the stations and in the booths where the station managers or station personnel work. And they're also will be distributed to the bus drivers that they would have. And that's basically how it would be recognized. Generally speaking, though, you don't forget the person who assaulted you. And people are creatures of habit. They want to catch the same bus to get to the same train, to get to work at the same time. And so it's pretty simple how we would be able to identify folks. But the specific way we'll do it, that'll be worked out now amongst the work group.
Okay. And I assume then as far as enforcement, so if you do spot somebody, you contact the police or you contact, that will just be, I see some shaking heads and that's
Yes,
what
ma'am.
ultimately, okay.
Yeah, we're not physically going to be
enforcers.
removing anybody. No. We would call the police and the police would remove that person.
Okay, all right, thank you very much. Thank you,
Thank you,
Madam
Senator,
Chair.
for the question.
Thank you, Senator. Senator Mounts.
So, thank you, Madam Chair. So the bill now is mostly a work group? Is that what's going on?
Yes, sir. So it's been amended to where it'll be a work group that'll be formed, and we just need to have it done. We'll meet first in June, and then we need to have the policy done by October. I'm sorry, you didn't hear me. We'll meet by June, and then we will have the policy done by October to go into effect October 1st.
And there would be enforcement, I guess, is it MDTA police? Would that cover the transits that are included in the bill? Because I read through them real quick. I closed my computer.
Yes, sir. The MTA police will be the main enforcement mechanism.
Right. And then, you mentioned this, you were just answering questions, but, concerning things like an automatic restraining order, you have to have notice, the person has to have notice. Will there be law enforcement on the work group?
Yes, sir. Yes, sir. The union they basically AFSCME. They're the union that represents the police. They will absolutely be a part of the work group. Yes, sir.
Yeah. Well, I would just recommend you consider making sure you have like a real police, like not just a union rep.
Well, there are going to be officials there as well. The MTA is going to send someone. The union is going to send someone. And then we're also going to make a push to have someone from Workman's Comp on the committee as well, just so they have that, because they have that raw data as to how prevalent this issue is and how much it's costing the state and so forth. So it will be a pretty robust work group, and we'll be able to knock this problem right out.
I wish you the best.
Thank you, sir. Of course, once we get it out of committee, right?
I like that sale. Yeah. I'm buying. There you go. I'm buying.
That ends the questions for this panel. Thank you all very much. We have two more favorables. It's Jay Johnson and Trina Few.
Madam Chair, unfortunately, Mr. Johnson couldn't make it today. He had a medical emergency.
I'm sorry.
However, Trina is here. She's one of our members, and she'll gladly speak.
Thank you. Well, Trina, I didn't mean for you to have to come up all by yourself. It's just how it worked out. Maybe the delegate would like to stay with you and give you some support, or supporter David. That's fine.
Am I on here? Okay. Okay. Oof. Madam Chair, Vice Chair, members of the Senate Finance Committee. My name is Trina Few. I am a member of the Transportation Division of SMART. I work as a conductor for Amtrak and MARC with 13 years of service. I am urging a favorable report on HB 1144. While working on an Amtrak train in Wilmington, Delaware, a woman running down the platform came to me and asked, "Is this train whatever?" I replied to her, "No, this is not your train. We do not accept passengers at this location. We only let them off." She immediately became belligerent, swearing, cursing at me. She even spit on me. A conductor from another train located across the platform from me radioed for police assistance. Being that the attack was unprovoked, if it weren't for him being there, certain things would have escalated further. As a Maryland resident, I fully support HB 1144. The commuting public utilizing public transit service depend on us to get them to and from safely. When people feel they can get away with doing anything they want, lawlessness takes hold, at which point it becomes impossible to do our jobs. We as a state must send the message that riding public transit service is a privilege, one that should not be abused, one that should be protected. Victims of assault should not have to face their attackers day after day after day as it currently the case. Thank you for your time and consideration. I urge a favorable report.
Thank you for your testimony. I don't see any questions. That ends all the favorables. We have Melissa Rothstein as one unfavorable.
Good afternoon, Madam Chair, members of the committee. My name is Melissa Rothstein. I'm the Chief of External Affairs at the Office of the Public Defender. And I have to say, after hearing this testimony, my testimony changes quite a bit because our primary objection to the bill is not to the work group. We think a work group is great. The problem is, if you look at the bill itself, it includes a ban before the work group. And specifically 7-705.1 section B1 still has the original ban language. So our concern is sort of creating that before the issues are worked out by the work group. And because that ban that's supposed to go into effect in June and be in effect until the code of conduct is developed, that ban has no time limitations, it has no appeals process, it doesn't have any of the protections that we would want to see that the work group and the developed code of conduct presumably would have. So if that's removed, that changes our position dramatically. The only thing other than that I would add is that we would also like to see that the work group includes some other outside stakeholders. Maybe those are already considered. We're not part of that discussion process, but there are vulnerable groups that would be particularly impacted this with respect to disabilities, with respect to youth who need transportation to go to school, and with respect to sort of low-income individuals more broadly, and would hope that the civil rights of those individuals are part of that discussion. And with that, I'm happy to answer any questions if the committee has.
Thank you, Melissa. Do I have any questions for Melissa? No, thank you very much for your testimony. So that ends the hearing for House Bill 1144. It ends our hearings for today. We're going to take a short break while our committee manager sets up our voting. And hopefully all of our members will be here by the time we vote.